and we are officially live.
Okay, thanks. Good morning, everyone, and welcome to this meeting of the Oregon Early Learning Council on March 30th, 2022. Glad to see you all here. And I'm going to ask Remy, our fearless council administrator, to call the roll, please.
Fearless, thank you, Sue. Okay, and we have Angie Blackwell. She will be here shortly, so we'll mark her as present for now. Katie Books. Excellent, thank you. Peter Buckley.
Here.
Thank you. Ann Kubich.
Here.
Thank you. George Mendoza.
Here.
Thank you. Dr. Peg Miller.
Here.
Thank you. Kali Thornlad.
Here.
Thank you. Sue Miller, Chair.
Here.
Thank you. And now to our agency leads. We have Pat Allen, the Director of the Oregon Health Authority.
Here.
Thank you, Pat. So excited to have you here. Colt Gill, the Director of the Oregon Department of Education.
Here for about an hour. Thank you.
Thank you. Thank you, Colt. We're happy to have you for as much time as we can get you. Margaret Salazar, the former Director of Oregon Housing and Community Services, she is excused today. Liesl Wendt, the Deputy Director of the Oregon Department of Human Services, will be joining us shortly. And finally, we have Alyssa Chatterjee, the Early Learning System Director of the Oregon Early Learning Division.
Here.
Thank you. And we have quorum.
Yes, we certainly have. Thank you, Remy. So this morning, I've asked Alyssa if she would give us just sort of a snapshot of what the successes were at the legislative session that just ended 2 weeks ago. And also I've asked her to give us an update on the procurement process that many of us have heard from our constituents, as it were, about some challenges with that. And then I would certainly invite Director Allen and Director Gill, if you want to provide any quick legislative updates as well, we'd be delighted to hear those. And then we will launch into our debrief on OHA's presentations at our last meeting. So Alyssa, welcome and good to see you again.
Thank you. Good morning, everyone. I will just quickly run through some slides, and then I know Remy will send these out, but it was a very eventful short session for us. These are the kind of key pieces of legislation that passed. House Bill 4005 included the movement of the Department of Early Learning and Care establishment date to July 1 of 2023 from January 1, just to give us a little bit of additional time and some buffer for our 45 projects associated with implementing the new agency. It also moved employment-related daycare background check processes to the Central Background Registry and included an increase to provider reimbursement rates for this biennium. House Bill 4033, as you'd heard from Valeria, revised the Tribal Advisory Committee membership to support the Tribal Early Learning Hub and better support sovereignty in the government-to-government relationship with Oregon's 9 federally recognized tribes. And then Senate Bill 1547 also requires that recorded programs are now enrolled in the Central Background Registry. We also had a lot of funding on the table. So there was $38 million that was released for preschool expansion. These were not new dollars. These were Student Success Act early learning account funds that had kind of been earmarked and set aside for us to fund Healthy Families Oregon, Oregon Prenatal to Kindergarten, and Preschool Promise, pending kind of showing that there's the available capacity to expand in community. We also received $5.2 million for the Early Childhood Suspension and Expulsion Prevention Program and $5.8 million in a special purpose appropriation for 34 ELD and DELC positions. So these were the funds that had our name on them, and we just needed to come back to get those funds released. There was also new investments, $2 million for Healthy Families Oregon to go specifically towards wage increases, as well as another $2 million for relief nurseries. House Bill 5202, which is one of the big budget bills, also included a number of childcare investments. So we'll see childcare retention enhancements. These will be two $500 payments to childcare workers at all levels, not just license holders, but the staff that work in facilities. 3 local community investments to Uvalde, Neighbor Impact, and United We Heal, capacity building grants to Seating Justice to distribute across the state, $22 million there. And then there was, in addition to the special purpose appropriation, we also received $3.6 million for 32 additional positions, bringing us to a grand total of 66 DELC-related positions. So we are on track to implement new rates for ERDC by June of this year. Regulated subsidy providers can begin enrolling in the Central Background Registry with full enrollment by July 1 of 2025. And Senate Bill 1547, we've also are able to start enrolling recorded program providers with full enrollment by June 30 of 2023. We're determining the procurement impacts of Healthy Families Oregon. There was $800,000 in that $38 million that was set aside. We're looking at that alongside the $2 million for wages. Contracts are being amended now for Oregon prenatal to kindergarten, and we are continuing to work on the request for applications for Preschool Promise expansion this spring. We are in the process of working to contract with a centralizing entity. The goal is to do that by July of this year, with service delivery by February of 23. And we are hiring now for 66 positions through June of 23. So working fast and furious to get our team staffed up. On the childcare investments, these funds don't flow through the Early Learning Division. So the retention enhancements are through PSU's Oregon Center for Career Development, utilizing the Oregon Registry Online, and the Higher Education Coordinating Commission is responsible for working on getting those dollars to them. The 3 local community investments are contracts directly with DAS, and the capacity building grants will be a contract with DAS and Seating Justice, and the funding for that is expected to start coming out in 4 to 5 months. So that's the quick legislative update. On the procurement front. Year 2 amendments are moving for release and should be out the door by the end of April. Year 2 amendments are moving for Preschool Promise by the end of April, and we're working on the expansion request for applications. And the Equity Fund Year 2 amendments are also moving for release at the end of April. We already have Baby Promise, Healthy Families Oregon, Hubs, Coordinated Enrollment, CCR&R, and Relief Nursery grants in place as of today. So that's the super quick update on where we currently stand.
Okay, any quick questions? And let me just remind you that this afternoon, John Reeves is going to be here giving us an update on the suspension expulsion program. So I'd like to hold questions about that part of Alyssa's comments until this afternoon. But any other quick questions? Kali?
I have, I guess, a question and a comment, Alyssa. I'm sure this is not going to come as any news to you. We've been hearing a lot at the Children's Institute about contracts not getting out to providers on some of these really important programs. And I have to say it's a concern to me, and I'm bringing it up to the council because I see it as a big equity issue. It's come up most around Preschool Promise. People are not getting contracts in place until late summer, where they are given a small window to then be able to do this coordinated enrollment. That in and of it, that's a whole nother conversation that has a lot of challenges. But when it's presented to me, and I'm out in Medford right now, so I've met with folks out here. I've talked with folks in actually other parts of rural Oregon, not here, as well as the metro region. And this keeps coming up. And what it sounds like is that for families who are using public services, so to me, low-income families, it's become a tale of two cities where their access to early childhood slots is very different, and they have to deal with all these hurdles because we're not getting contracts in place. Also, they're fortunate here that they have an ESD supporting their hub, but for the hubs that are not supported by stronger institutions, they're having to try and float all of these contracts without having them in place. So I'm wondering, what can we do, Alyssa, as a council to push? I know there's DOJ and there's all these other pieces, but this is not right. And I'm like, I don't know what sort of emergency work can be done and what the council can push for. I don't know if there's a policy change that can be made, but it's a disservice to kids and families that are most in need that we're not getting these contracts in place earlier.
Absolutely agree, Cully. I think at this stage, there, just to be honest, not much else to do. So most of those contracts are now out the door. Preschool Promise is the one that we're finalizing. Part of this is capacity. So I'm really excited. Of the 66 DELC positions we got, a handful of those are for procurement. So having our own procurement shop. I've worked really closely with Colt and with Kai Turner at ODE to kind of make sure we're lifting up and prioritizing those direct service contracts and grant agreements like Preschool Promise. But also, I think standing up our own shop will give us some advantages. It's all going to be built around what we need and who we're serving. I've already started talking with staff, and we've got some process changes that I'm really excited about that are going to streamline the process for our staff. And so taking kind of lessons learned and building off of those. I think I'm also continuing to work with DOJ, making sure that they kind of understand the service level and the need, but it really is right now just all the grants on the same timelines, trying to run through a shop that's also serving the Department of Education and the variety of grants and contracts that they need. So I think part of the answer is it's our goal to be better in the future. One of the things we've talked about is shifting the grant agreement period. We renew grant agreements every year, and amending grant agreements mid-cycle is an entirely new process that has to get folded in. And so these are the pieces that we're trying to change for the Department of Early Learning and Care, because we'll be able to build that system based on how we do business. So it's not a great answer because we kind of are where we are, but that's a really big piece of what we're trying to build for the future. And we're recruiting our procurement director now. And our goal is really to bring in somebody that knows procurement well enough to say, here's the gray space, here's where you can find flexibility, and to work with DOJ to make sure they're on the same page.
So you're saying moving forward, because my understanding is this is not the first year, this is like the second, third year of this challenge. Moving forward, you've put things in place where this will no longer be a problem.
That's what we're building. So a big piece is going to be having our own procurement shop. Those are positions we're hiring for right now. I think we have another procurement specialist that we're recruiting for starting Friday. We've got the procurement director out. We're trying to recruit for a chief of operations. So those are all going to be critical pieces, and changing those grant agreement spaces. I think the other piece too on Preschool Promise in particular is we've only done one expansion and the pandemic hit. And so we were hoping to have a lot of learnings to be able to modify our process that we didn't get because it was a pandemic. And so the program and service delivery didn't move forward as any of us had hoped. And so this is sort of in a lot of ways the real first time of expansion. So trying to find that balance between process improvement and not delaying the procurement process is where we are right now. And so we're trying to get these out the door, make a note of everything we want to fix so that as we start to build this procurement team, we can be really thoughtful about those considerations for future processes.
Okay, thank you, Alyssa. And Colt, I know you and Alyssa have been working together on this because you have procurement issues also, I am guessing. But I don't know if you want to add anything to what Alyssa has said.
No, I think Alyssa covered it well, and it is I guess the one thing to add is it's procurement issues across all the state agencies. So with so much federal dollars coming in at one time, and the legislature, frankly, spending a lot more this biennium than the previous biennium, and there wasn't the back end support to facilitate that. And so it was a huge problem, and procurement was difficult before this biennium, and this biennium, it just got a lot more challenging. So I have the same hope, though, that Alyssa does for what will be set up at Delk and setting up a procurement team to take this on. And hopefully we are seeing some additional positions come on at DOJ to support procurement as well. DAS is trying to hire. We also received additional positions, some of which will be for ELD in the interim as well. So we're all trying to work through it, but the supports came long after the procurement deadlines were here. So
Okay. Thanks, Colt. We appreciate your partnership in all of this.
and so I see the chat from Katie. Alyssa, you can answer for sure for ELD, but we did send out to all of our procurement partners, everyone we pay in the community and schools, what the challenges have been and where they're sitting and where they are in the queue. So we've been pretty regular about that communication from ODE. I think the same has been true for ELD.
Now we're working to kind of let them know where they are in the process. I think there's always room for improvement. So if you like Kali, if you're hearing kind of there was a lull or there's not enough information, that's definitely things that we want to take in. And if we can improve the transparency and the frequency, we're always up for doing that.
Okay, thanks, Alyssa and Colt. So let's switch back to the regular printed agenda and talk. I want to do the debrief on the wonderful presentations that the OHA staff presented at our last meeting. So Pat, your staff did an outstanding job of updating us on some very key initiatives going on. And I know from Director Allen that he has to leave for another meeting at 10:30. So I wanted to just give Pat a chance to make any comments he'd like to make. I'm sure he's looked at sort of the summary of what his staff have presented. And one of the specific requests of the council from those presentations, you'll remember, council, is from Kate Wilcox asking if we would help facilitate a process for trying to promote the coordination of home visiting programs in Oregon, of which we know there are multiple, 7, 8, or 9 of them. So I wanted to give Pat a chance to just make any comments before he has to run to yet another meeting.
Yeah, thanks, and apologies that I can't stay longer. Those things seem to go swimmingly without me, so maybe the quicker I can get out of here, the better. First, just a big thanks to my team, who have really done great work, not just here but in all kinds of places in my absence. We had a pretty phenomenal legislative session, including the same thing that's been, going on around state government: more resources, more positions. Between the 21 session and the short session, I used to live in a world where you'd try to get 5 positions and it would be, like crawling over gravel to be able to do it. We got 700 positions over those 2 sessions. If I haven't checked for sure, but I think if those positions were their own agency, it would be like one of the 15 largest agencies in state government. And everything that Alyssa and Colt have said is right about just the challenges of, you don't just make 700 people appear. You actually have to recruit them and hire them and onboard them. And the same thing goes for us as with ELD around contracting. The infrastructure to do all that work just doesn't exist. And so there's some huge challenges around that. I was really glad to see the summary notes on home visiting. It actually kind of takes me back to my first days chairing the Clackamas Children and Families Commission, where we talked about home visiting and learning about the fact that there were all these different models for home visiting out there, and that some models got along great and others didn't get along so great, and there was potentially lots of room for overlap and duplication and confusion and those kinds of things. And so the notion of the council establishing a home visiting committee, I think, is a great idea for us to, at a minimum, provide a forum where we can get good exchange of information and potentially do some coordination across those models. And so I'm looking forward to that. developing over time. And again, I'm sorry that I can't stay very much longer. Thanks, Sue.
Well, thank you very much, Pat. And as you know, I'm sure, I think we all recognize, for this home visiting coordination to happen, it's really going to be relying on some of your key staff people to help figure out what role we can play. So having you endorse this idea is certainly foundational for this effort.
And so far, Kate Wilcox isn't blowing up my phone and she's on this call. So I may not be too far off in thinking that's a good idea.
Oh, good. She's smiling. This is a good sign. You want to make any comment, Kate, before your boss leaves?
Well, actually, in this mode of this conversation about hiring, I am hiring some managers in our section. And so I will have a little bit more bandwidth to be able to help lead this charge. So I just appreciate the support Pat has given us over the years on this initiative and all the initiatives. It's really been important. So
awesome. Thanks, Kate. And Kate's going to be able to stay with us, Council. Okay, Pat, thank you. We appreciate you lots and your staff. So Council, let's go back to the conversation.
Sue, can I just interrupt? Will we come back to this home visiting, the notion of a home visiting committee later on? Or is this, should we continue this discussion now? I just want to check on the timing of things.
Really good question, Anne. Thank you for asking that. Sure. Why don't we just jump to that since we've opened up that topic? As you know, that was the third presentation at our meeting last month that Kate made. And then Lisa Harnish from the Marion Polk Hub helped with some additional information. But let's talk, Council, about home visiting in general and what the Council's role might be, sort of what you're hearing in your own fields. And Anne, I know your foundation has been involved in home visiting coordination for years. So maybe you'd like to offer some comments about this.
Yeah, no, I am passionate about this, so I'm happy to talk about it for a very long time, probably longer than anybody else on this screen is, but except for maybe Kate. Yeah, so I think that, we have obviously, so we're based in Southwest Oregon, and we do a lot of work in Southwest and South Central Oregon, and have been concerned about this question of exactly what Pat was talking about how there's lots of home visiting models, but that there's overlaps, there's confusion, there's not much interaction between them. There's some are oversubscribed, some are undersubscribed. Families don't necessarily get directed to the one that matches exactly what their needs are. So we actually have developed a program of work on home visiting systems coordination in Southwestern and South Central Oregon. And I want to say we've been at it for 6 years. So I want to just say that when we think about doing this, we have to think about building the capacity, which has been a theme we've already heard this morning in everything, and taking the time and doing it in ways that are very community centric and community specific, because each place is different. But we've been doing this for 6 years, and I'd say it was sort of after year 2 where we could really start to see some changes happening. Now, 6 years into it, we see that the coordination is really working. It's made a difference among the providers. They're talking to each other. They can see the differences in how the families are getting access to the services. We have position descriptions that we've written about what is a home visiting systems coordinator. So this is, I just believe very strongly that this is something that is doable based on our experience. And I am willing to step into any kind of advocacy position on this council to suggest that we do have some kind of a committee, and to oversee this. And I think it's a perfect role for the ELC, given Raise Up Oregon and our mission to coordinate across agencies, and that's what we're trying to do. So to me, I think this really hits a sweet spot. And if Chair Miller, you ever need a motion in this discussion to to set up a council committee to promote and help coordinate the home visiting programs and models in Oregon, I am willing to step in and make that motion, but I will seek guidance from you about when and if and when you want me to do that.
Yeah, so why don't we go ahead and put a motion on the table and get a second, and then we'll discuss the motion.
Well, can I do that then, since I'm so enthusiastic about this?
I would be delighted to have you do that, Anne.
So I would like to move that the council form a committee to promote and help cultivate coordination among home visiting programs and models in Oregon.
I would second.
Awesome. Thank you, Anne, and thank you, Peter. So motion's on the table. Let's discuss it. Sure, Peter, as the second.
Just briefly, Sue, and I mentioned this to you yesterday when we talked. When I read the reports about the strengths and challenges of the different programs, some of them were consistently working with their early learning hubs, some weren't. So that to me was like this huge red flag of saying we're not coordinating, and we have to coordinate. The folks in the early learning hubs have to understand what the home visiting programs are doing, and vice versa. Our child care resource folks need to also be a part of that conversation. We have to have a system, not just programs. So that's why I strongly support this.
Yeah, I would agree 100% with that. We have a program in Yamhill County where we have a centralized referral center for home visiting programs. And I mean, I see this sort of universal home visiting, and I would hope that we can make it universal as being the entry point to that, and then being able to meet each family's needs and wishes to, as far as meeting the goals that they have from the home visiting program. And again, getting all of those coordinated, having people that are aware of the strengths of individual programs and what's going to best meet families' needs.
Great. So Peg, you will also have some local experience that can help inform this committee as well.
And I too am passionate about this program, have seen the positive effects that home visiting can have for families. I think we have a long way to go and to really establish trust with families to get family buy-in for this. And I think that's really why I'm passionate about the universal aspect of this, is that I think for a long time it's been kind of labeled as, oh, you're a needy family or a family that, has problems, instead of saying, gosh, these are the resources we have to offer. How can we build you up with this?
Yeah, good perspective, Peg. I think that broadens it. So it's really more of, or as much of a family support model as a home visiting model, sort of how it gets framed up. Excuse me, Kali, I interrupted.
It's okay. I just wanted to add to Peg what she's saying. I agree. I think there's a lot of trust that needs to be built with families. And then when you put a racial overlay on that, it's really complicated. We know we have workforce issues as it relates to infant child mental health and all sorts of things, child care. This is an issue in that I think representation is very important in the home visiting community. We don't have adequate representation, both from a geographic standpoint and a racial ethnic standpoint and a language standpoint. And so I think as we examine this, I too think it's hugely impactful. And if we do it wrong, it could be traumatizing for families. So I hope that the committee can also look at the workforce side of things and how do we address shortages in certain communities so that we have the workforce to implement a universal home visiting program adequately.
Okay, yeah, excellent point, Kali.
And Sue, just a couple points. Once upon a time in my career, I was a parents as teacher trainer and did home visiting. So can speak to the strengths and challenges, but I think Kali, you're spot on. It's who goes and visits the home, right? And that cultural humility And it's fun, right? To your point, Peg, it's not an intervention per se. I think every parent can use some assistance when their child is an infant. So just a huge plug. And it is complicated. And I think, Kate, I first met you working on a federal grant on this topic many moons ago. So I think as a state, we've gone at this a few times. So perhaps also making sure we learn what worked and didn't with some of these conversations around coordination, et cetera. The other piece I would add, and I think I've mentioned this to this group before, but we do critical incident reviews within our child welfare program when a child dies and has had some amount of contact with us. And overwhelmingly, they're infants, and overwhelmingly, their families struggling with addictions. And right, there was a home visitor in the home that could flag, that could wrap around supports. We're not the right intervention, child welfare, right, in that moment, but home visiting in connection to services and culturally appropriate supports probably is. And so that particular intersection maybe even can be where we focus, because it's a tragedy when we're learning this, and there's a lot of interest among this group and others to be more upstream. So just wanted to put that on the table as well.
Great. Thanks, Lisa. Lisa, will you remind us, does ODHS have home visiting programs?
Yes, narrowly, I would say, not necessarily comprehensively, but you're going to hear from April in a little bit about the child welfare vision for transformation, and you'll just see lots of ideas. I imagine many of you will have popcorn suggestions for us about how to take that vision and tie it to this conversation.
Okay, great. So we'll look forward to you all being a part of this committee if this motion passes. Other comments from council members or questions? And Kate, I'm going to give you a chance to weigh in here before we vote on this motion. But council, any other questions or comments? Kate, how about giving us your perspective and also letting us know if we can count on you to help provide the leadership?
Well, my mom was a public health nurse who did home visiting in Southern Illinois, St. Louis area way back in the 40s. And so this is in my blood. So I'm not going anywhere until I retire, but that's a long way away. So yes, you can count on me. And like I said, we're going to get more supports within our section that will allow me more bandwidth to be able to help with this initiative. I do want to say that on this call, Lisa and Alyssa will remember way back when, it must have been 10, 12 years ago, we were doing this exact process with the leadership of the various models. We had big poster boards, we had algorithms, we were trying to figure out how to diffuse sort of some of those turf issues. And the bottom line is that there was more need than there was capacity. And so I think what we've struggled with and what we're looking to the council to help us do is to elevate this and provide that state level leadership to provide the support at the local level. That's what we're hearing at the local level. It's like, where are our state partners to help us figure this out in a coordinated way? And we know that recently there's just been a lot of turnover and pandemic and just a lot of things that have really done everything that could happen to not let this happen. But we are in a much, and I think 2022 is going to be our launching off point to be able to re-engage with this. And the leadership that the council can provide will be essential for taking what we were trying to do as agency leaders and staff and managers to another level, and really help to anchor it, provide that state level framework, and then support at the local level. What does that look like for each community? The North Star vision that I sort of have, and I think others do too, is that we get away from model names and we actually start talking about how this is, Oregon visits. Every family in Oregon gets offered a home visit. It doesn't matter what the model is, that filters out based on eligibility. But I think that that's something that the council can help us put forward and, to get tactical brand, if you will. But the coordination underneath that umbrella has to be there. And that's where the work that we need to do now. But I really do look forward to the day where every family is offered that and every family demands it. And every family gets what they need delivered by a trusted person for them, be it in a community, in a language, and, and so that we really are able to, I was telling my sister-in-law who's Canadian originally, I said, we're trying to make Oregon like Canada. So that's my pitch.
Awesome. Thank you, Kate. We've heard both from Kate and Liesl, and obviously we would hear from Alyssa that this has been on the drawing board many times and for many years, if not decades. So as I think about that, I think, oh my gosh, discouraging, because what if it hasn't happened in the last 10 or 20 years, can it happen now? And then I realize how fortunate we are that we have people involved in this today who have that history. And so we can build on it and just take off from a much more informed point than if we were really starting from ground zero. And Anne obviously has 6 or 7 years of experience at a local level in doing this work. So we've got a lot of expertise, and we're starting from a very strong position as I see this. Alyssa, your staff will have to be involved in this effort as well. So do you want to make any comments about this?
No, I think I agree with you, Sue. It's really exciting. And I know we've kind of started and stopped. And there's been the barriers, that it does feel like there's a moment right now where it just feels clearer. And I think we have a lot of opportunity. I would say as we're becoming DELC, it's an opportunity for us to take a look at all of our processes and see how we can do things differently. And I think that's also an opportunity to say, where can we be partnering better? Where can we be stronger in our coordination and build that into our processes, at least since we have this chance to look across the board at everything that the agency does. So I'm really encouraged, and it does feel like there's a moment right now that we can really build on this and keep this momentum going and really get to that place, Kate, that you're describing, of every family having access and demanding that level of service that they need and should receive. So we're ready. Really excited, I think, to have seen some investments and recognition from the legislature in the Healthy Families Oregon program, and the importance of wages in home visiting, which requires such a level of knowledge and expertise and is not met with the wages that are appropriate. So hoping we can continue that trajectory as well.
Great, thanks, Alyssa. And I think circling back to Peter's early comment about the role that the hubs can play in this and the coordination, it's sort of what they're set up to do. So we'll certainly want that to be a part of our conversation and committee. Okay, any other comments? Yes, George.
Some quick thoughts that I had to just, I'll say popcorn out, was anything that can bridge Raise Up Oregon and things within the strategic plan to create alignment is great. Healthy kids, healthy families, healthy communities is always like the number one. Anything that we can do also in this process where we address needs or find out gaps that are there and that we're addressing those gaps. I also feel like having like skill development opportunities in every community or in every region is very important. So if there is skill development, whether they're in a preschool or I'll just call it in a Head Start or any kind of center, but if there's just skill development opportunities in general that are open to families, and we're really good at doing those kinds of things, whether it's relationships, whether it's social emotional, whether it's math or reading or literacy or numeracy, any of that would be great. And then if there's any system transition type supports when they start to get into schools, when they start to get into kindergarten, things that really create kind of a really good transition into life for children, those are things that I guess I would say I'm interested in learning more about or hearing more about. Thank you.
Awesome. Thanks, George. Good points. Good points. All right. I'm guessing we are ready for voting on the motion. So all those, Anne, do you want to just read your motion again so we've got it out there?
Sure. I would move that the council form a committee to promote and help cultivate coordination among home visiting programs and models in Oregon.
Awesome. All right. Those in favor of the motion, why don't you just raise your hands if you would? And those opposed? That motion carries unanimously. Thank you. Council, yes, cheers. And thank you, Kate, for your support and encouragement that we step into this field. And obviously we're doing it with great enthusiasm. So council, let's broaden this now so we can talk about some of we can still talk about Kate's presentation, but about what Steph presented. And thank you, Steph, for joining us this morning on the waiver. And I'll give you an opportunity to update us, Steph, if there is an update on the waiver. And then any comments we might have on what Sarah Kleinschmidt presented about the social emotional measurement that the CCOs are considering. So Sarah, Steph, any update on the waiver?
Nothing too exciting. We're in a phase right now of question and answers, Q&A with our federal partners, CMS, after we submitted the waiver application. So right now they're just asking a lot of clarifying questions. So we're on like a weekly cadence, focusing on different parts of the waiver. At this point, which of course we have no way of knowing how negotiations will actually go because they will go likely through the summer. They're really positive about everything, which is just really exciting for us. They have shared that they've already taken a lot of this all the way up to the White House. A lot of this would be pretty monumental changes for the Medicaid program and could set the stage for other states as well. So we'll see. It's really exciting. It's a lot of work. And I'm optimistic about it. And we'll just, as we get going, we'll see how it actually unfolds.
Awesome. Great.
Yeah.
Thanks, Steph. Very exciting. Very exciting. So council, I'll just open it up and see what your reactions are, thoughts, questions about what we did here at our last meeting. And I want to thank Harriet Dichter from Build for the great synopsis summary that's in our packets of the PowerPoints and the information presented last time. So thank you, Harriet, for that. So what stood out to you? What were highlights? You know, thinking about short-term, long-term. Long-term could be Raise Up Oregon updates. What are the pieces that you want to make sure we pull out of that? Peg.
There's a couple of pieces that are, again, I think are really important, particularly for young kids, and that's the continuous enrollment until age 6. I have seen so much fragmented care in young kids that are on Oregon Health Plan and off Oregon Health Plan and so forth. And I think that's going to really promote wellness in children and access to care. And I also really support the helping families in transition, whether that's from prison or that have experienced significant adversity. Those are times when people fall through the cracks, and that's a make or break time for a lot of families. So I think the more we can support that, the better it is. And certainly I think those are important parts of that waiver.
Yeah, good point. Other comments about the presentations? Peter.
Just very quickly, I'm concerned that Colt City had to leave at 11, so I didn't know whether we wanted to get to Colt. So I'll just be very quick on this and just say that the regional investment collaboratives, that's what I'm doing right now, the work I'm doing. So I'm obviously interested to see how that proceeds, because I do think that there's a lot of potential. The CCO model has showed us that there's a lot of potential to get more investments with decisions made on the regional level.
Yeah, good point. And Peter, we might want to come back to that and just expand that a little bit, because I think, you know, one of the themes for the councils in the past many meetings has been, how do we really work, you know, at the state level, policy level, but then make sure it's implemented and understandable and responsive and reflective of the local level. So that's sort of a constant theme that we keep bumping into or bringing up. Kali.
I would just second what Peter said, as I have had the opportunity to go to different regions. I think regional solutions are really critical, and they reflect the needs of the community and the collaborations that exist there. I've been really impressed with what's happening in some of our regional areas. And so I too would say, if there is a way that we can get more investments directly and it's not true for every area, but for those who are being creative and collaborative and coming up with solutions that are working for community, I think we should be investing in them. So I would just echo that.
Mm-hmm. Awesome. Thanks, Kali. Welcome, Angie. Good to see you. Thanks for joining us after your last meeting. And Colt, I know, as Peter points out, that you're going to be leaving soon. So I don't know if there's anything you would like to just offer to the council before you do have to jump off, even though your show is going to be, I think, in April, if I'm remembering correctly.
Yes, so I'm happy to wait until April. If you did want, I think at the beginning of the meeting asked about a short legislative update. I can share some of that if it's helpful, or
sure. Oh yeah, that'd be great. Thank you, Colt.
Okay. So there were some bills in the short session that we were following really closely and advocating for. The short session is not one where the agency gets to actually bring bills forward. We did work closely with the chairs of both the Senate and House Education Committees, as well as the subcommittee from Ways and Means on Education. We were able to see that House Bill 4026 passed. That provided grants to the districts that were impacted most heavily by the wildfires, and help support those districts to maintain adequate funding for the next 5 years as communities rebuild and houses are built. And we'll continue to watch those needs in those districts. House Bill 4031 was really important to us. This sets into statute an effort that we put underway through a hiring principle that I put forward to the agency. But what it did was it added the Oregon Department of Education to the Educator Equity Act goal, which is designed to help school districts and education service districts, ESDs across the state, hire staff that are reflective racially, ethnically, linguistically of the communities that they serve. Right now in Oregon K-12 schools, about 40% of our students are students of color, and a little around 11 to 12% of our teachers are teachers of color. So it's designed to help our educator workforce reflect the student body. The Oregon Department of Education was not a part of that goal. Now we are under House Bill 4031. So I'm really excited about that.
Awesome.
Yep. And we also, through the major budget bill, House Bill 5202, now have the opportunity to create the Pacific Islander Native Hawaiian Student Success Plan. So this will be added to our efforts with African American Black Student Success, Latino, Latina, Latinx, and Indigenous Peoples of South and Central America plan, our American Indian Alaska Native plan, and our LGBTQ2 SIA plus plan, and advisory group. So we're really excited about those. One big loss for us that we will continue to work with legislators on, we had a great legislative partner in Representative Valderrama and Neron, was the Racial Justice Youth Collaborative, to set up an organization for student voice in Oregon, to inform policymakers at the legislature, the governor's office, State Board of Education, and others. So we'll continue to work on that. And if you have time, I have a few more. that I can touch on. House Bill 5202, that budget bill, the big budget bill, did create a lot of positions as well. So there are some more positions for the Educator Advancement Council, which does cross over into the early learning world as well. And then the additional procurement positions that both Alyssa and I talked about, that's where those came from, based on requests from the agencies. There is a significant educator workforce bill that was passed, House Bill 4030, that we're in the midst of implementing. So this, the legislature invested about $100 million into educator recruitment and retention efforts and diversification efforts. So we're in the midst of beginning the implementation processes of this. So this will mostly land in grants to school districts and ESDs and membership organizations like the Oregon School Personnel Association, so that they can improve efforts in recruiting and maintaining a diverse educator workforce in Oregon. There were 2 bills around assessment that were passed. One of them, as we continue, we'll talk about one of them in April, as we continue to work together on the kindergarten assessment. There's one that may have some impacts there, as it asks the state to ensure that it is only providing for the minimum amount of summative assessments as required by federal regulation. And the kindergarten assessment is not required under federal regulation. So we'll want to talk about how that fits in under this bill. I think that we are okay to continue to work together on that and develop policy around that, but that will be one of the major topics that we'll want to cover in April. There was a superintendent's protection bill. So we had some school boards around the state of Oregon that were asking their superintendents to take actions that were in opposition to state rule or law. And so this helps to protect those superintendents to ensure that they can't be released from their position because they are acting within statute or within rule in Oregon. I think those are the highlights. Happy to answer questions, or if there's another bill that someone heard about that we want to visit about more, I can try to fill you in.
Thank you. Kali.
Nicole, I just have a clarification question. I've heard from a couple folks from the Latino community that the money for the Latino Student Success Plan has not gotten there. Is that correct? Or what is happening with that plan? And do organizations that are Latino serving have access to the resources connected with the Latino Student Success Plan in the way that the Black Student Success Plan contracts have happened? Is there a holdup that is procurement, or I don't know? It's come up a couple times by a couple different folks in the community. So I just thought I'd get some clarity.
Yeah, so I mean, there could be 2 different things here. So there are concerns about the level of funding that the Latino plan has in comparison to some of the other plans. And so it could be that you're hearing about. That's a legislative decision. We asked for significantly more in the governor's recommended budget and in the agency recommended budget than was received for that particular plan. We'll continue to do that for the 23 session as well. But that may be part of what you're hearing. The other part, I believe, is likely related to the procurement concerns that you talked about here. Those also impacted each of those plans and the grants related to each of them. So projects are underway, but the funds to support those projects were late. I believe that they all are out now, and there was some specific work we needed to do with DOJ related to ensuring that those plan efforts were funded to support the target students, but also could meet any discriminatory challenges that might come up. I'm happy to chat with you about that separately.
Okay, I think when you have your April time, it would be great to hear how the different student success plans are touching early childhood specifically, and how we're supporting culturally specific organizations. The more I travel in rural areas in particular, there's a concern about services to the Latino population, which typically is the largest population within the rural areas. And I just don't know what ODE is doing around the plans, specifically beyond the Black Student Success Plan. So I think that update, I imagine, would be helpful to other members of the council as well.
Okay.
Yeah, thanks, Kelly. Great suggestion. Okay, council, we have about 1 minute left before we're going to welcome April and our ODHS partners. So any last minute, yes, quick comments. Peter.
Well, I just want Cole to know that my daughter-in-law, who got laid off by the Shakespeare Festival when the pandemic hit, became a classroom assistant, loved working with kids, started taking some courses with the ESD on social emotional learning, became a substitute, and now because of legislation that you helped pass, now she's going to go get her teacher's license because there's resources for her to do that. So just want to let you know it's working. It's working.
That is amazing to see that working. That's great. Thank you, Peter.
That's a great sharing. Thank you, Peter. Congratulations to her as well. Okay. OHA, I want to thank you, Sarah, for hanging with us. And if council, we'll see what the afternoon looks like, if we have time this afternoon to come back around to any other comments we want to make about your presentations last month. We'll let you know. We're not expecting to see you, but we'll let you know, Steph. So, and Kate, you're here too. So thank you both very much. We are excited to continue our partnership and in fact, strengthen it even. So thanks. Okay, council, let's move on to another fabulous partner that we work with a lot, our ODHS partners. And we have both Lacey and April here as deputy directors. And I don't know if that's still the right title or not, who's here and who's in DC and who's in transit. Maybe you can update us on all of your changes. And certainly want to thank Angela also for her help in pulling all of this together. Oh, and welcome, Joel. Good to see you again, too.
Hi, Sue.
So I will let you all take it from here and thank you again for being here. And Lisa, thank you for your help in pulling this together for us.
Well, thank you. I think I'm running this show this morning. Good morning, April Flint Gerner, she, her pronouns. I'm Deputy Director with ODHS Child Welfare Division. And I am joined, and I see my ODHS friends here as well, but I'm joined for this presentation by the other Deputy Director, Lacey. Do you want to introduce yourself to this group?
Sure. Good morning. Sue, I'll always take the title good partner. So you can always, fabulous. I think you said fabulous partner. Yeah. Good morning, everyone. Lacey Andreessen. I'm the other half of the Deputy Director team for ODHS Child Welfare. It's great to be here today.
Thanks, Lacey.
So before we kind of start into the business of our conversation, I'm happy to provide a little bit of an update. Thank you, Sue, for reminding us that we've got lots of transitions and things happening with child welfare in particular. So Rebecca Jones-Gaster remains our active and very committed director. She, as many of you know, was nominated by the Biden administration to head up and act as the commissioner for ACYF. And although she has gone through the first level of the confirmation process successfully, she is waiting full Senate confirmation. And so while she's here awaiting that, she is really excited to still be the director, and we're really excited to still have her here. From what we've heard from Rebecca, and we're looking at kind of May at earliest, and it could even be sometime over the summer for that full confirmation. For now, we have our director absolutely intact. And then upon her transition, I will step into the role of interim director for child welfare.
Awesome. Congratulations and thank you, April.
Absolutely, absolutely. So I believe that we've got some slides that are ready for you all. Beautiful. Thank you so much. So I wanted to start off by, and I'm really excited to see our ODHS partners here that can help to talk about some of this as well. And I think we're going to leave some, try to leave as much time as possible towards the end of this presentation to have some conversation and discussion. And so excited to see some folks in the conversation with us today to help talk about this. But Department of Human Services is undertaking some exciting work that's focused on the whole well-being of Oregonians that we serve, and it's really centered with our commitment to advancing equity. You'll hear us talking about the ODHS Equity North Star, and I'm absolutely happy to provide a copy of that if you all have not had a chance to see that. And so this effort that we're calling the Building Wellbeing Project really aims to focus on more on our upstream solutions, close some of our service gaps, and act as a framework for more aligned and integrated approach to serving families alongside other child, family, and community serving systems. And we really want, ultimately our communities to experience working with ODHS where there's no wrong door. We really want to present as one agency that's aligned and committing to serving families with dignity, empathy, and respect, and breaking down the barriers to accessing the kinds of things that they need to experience family and community thriving and well-being. And so we know that we can't get there alone, and that it really is going to take us kind of talking and sharing power with one another. And we're really hoping to expand on how child welfare in particular is kind of leading in that effort right now. And we really will leave some conversation towards the end of the presentation to talk about what that partnership might look like and hear from you all. Next slide. So you all have heard about the Vision for Transformation, and I'm going to let Lacey talk a little bit more about the Vision for Transformation and how that Vision for Transformation really connects with the Raise Up Oregon framework. Lacey?
Thanks, April. Next slide, please. So when Rebecca and April and I took our positions over the span of those first few months, one of the things that we readily identified was that we needed some deep engagement with people with lived experience, with our stakeholders, community partners, and our staff to lay out a vision. Because when Rebecca came to Oregon, one thing she was very clear about is that too many children are in foster care in Oregon. The system is disparitably and disproportionately impacting particular populations. And it is our charge to move from oversight and surveillance to preservation and transformation. So we spent some time in deep conversation with all of those stakeholders, and with the assistance of Joe Metlin, crafted the Vision for Transformation. The language of the vision brings a very strong racial equity and anti-racist lens to the work that we do, and really articulates our belief that children do better and stay better with their family, and that we move in this work with values. And so we've created it collaboratively and through discussions with all of those people to really innovate and bring to life what we're now operating under, which is our Vision for Transformation. Next slide, please. There's 3 pillars to our vision. And as we looked at this visual of Raise Up Oregon's work and our work, we see some clear opportunities for alignment and collective impact. And our 3 pillars of the vision are supporting families and promoting prevention, enhancing our staff and our infrastructure, and enhancing the structure of our system by using data with continuous quality improvement. One of the things that we have charged ourselves, our teams, and those we serve with is anytime that we come to you and ask you to behave in a certain way, give you guidance about how to interact with community partners and the families that we serve, you should see that work reflected in this lens. You should see it with value. You should see it falling into one of these 3 categories: supporting families and promoting prevention, enhancing staff and infrastructure, and enhancing our use of data. And if you don't, challenge us back because we want to make sure that we're living into the commitment that we've made and we've laid out And also that we honor the voices of the people who helped us create this vision as we implement it. And one of the things that's been exciting for us to see over the last, it's almost been 2 years now, 1.5 years, is that we hear our leaders in delivery, our own team members talking about the vision for transformation. They show up in what they're doing and describe where it fits within the principles. And we've seen collaborators and partners and stakeholders really accepting and leaning into the vision and what we've asked to do as well. So while we are sad to see Rebecca transition and grateful that she'll be advocating for us at a federal level, we feel like the good work has been done, that this is the way the agency is moving, regardless of whose ever faces are in these particular boxes. Next slide, please. April, I'll give this one back over to you.
So many of you have seen this image or this slide, and I know I don't want to belabor it, but I do just want to make sure that we're really clear when we talk about advancing equity, what we are talking about and child welfare connected to our vision for transformation. And I think some of it is about, first we've had to, really soften the soil with our staff, and we still have a long way to go. But with our staff and our resource parents are really understanding what equity work is about and what anti-racist work is about. And what we're really aiming for is justice. And so we are really talking about, and as well with the Building Wellbeing Project, how are we really centering equity in our work in a way that dismantles barriers to children, family, communities, tribes experiencing good outcomes, right? And whether those outcomes are, seeing the game, playing the game, sitting in the stands, owning the stadium, right? Whatever those outcomes might be, we have to really be honest with ourselves about where we have barriers, where we've created barriers, where we are reinforcing barriers to children and families and communities and tribes experiencing those outcomes. And so, we've begun to have conversations, particularly around the anti-racism work, around, our discomfort is not a barrier that's a good enough excuse, right? Because I'm uncomfortable in the conversation is not a good enough excuse for us not to continue to push forward in the conversation. And so, part of the vision for transformation is really about looking at our data and helping to tell that story around, are the things that we predict are going to help us eliminate some of those barriers and increase access and equity, are they working? And are they not? Are we experiencing things that need to be tweaked? Are we experiencing things that we really shouldn't be experiencing? And so really that holistic look via the vision for transformation has to be grounded and centered in equity, or none of those other things work, right? And so we know, and we are going to know that we're headed in the right direction when an individual's or families or communities' intersectional identity are no longer predictors for how they will experience our system. And largely our system, yes, but the larger child and family serving system. Because we know that when we talk about things like racial disproportionality and disparity, particularly for child welfare, when we talk about really wanting to push upstream, we know that a child's likelihood of entering foster care is predetermined long before that call comes to the hotline. So we have to work in partnership around dismantling the ways that structures have been knitted together to either benefit families or create barriers. And so we're going to talk about in just a minute some of the ways that we're thinking about being good partners and how you can help hold us accountable for being good partners, because we are all aiming to make sure that everyone has access to watch the game, own the park, sit in the stands, play the game, whatever it is, that those child and family and community outcomes, that we're being really honest about who can access them and who can't. Next slide. So a couple of things that child welfare has been doing, and we're really, really proud of the momentum that we've been gaining around our Equity North Star and equity being our work. We really have been leaning in to really center equity in the work by saying to our staff, like, I don't know where in social work practice we got away from equity being centered to the work, but those social justice and equity kind of competencies and values that are the center of social work practice, we have to bring them back to the forefront and really say to the people that we're hiring, we have a responsibility, whether that's at the individual, the interpersonal, the agency, or the structural level, to look and see, is there a fence in the way, right? And if I'm in the way, then I've got to do the work. If it's decision-making that's getting in the way, then we've got to look at our decision-making. Whatever it is, really helping our staff understand the fullness of an equity framework that you just don't train away, right? And so I think historically, we've talked about equity work from a training perspective, and we don't train away oppression. And so really helping staff also to understand both the individual, that interpersonal, the agency, and then the structural responsibilities that we have to do all the things you're seeing on this slide, understanding historic trauma and the healing power of culture, really sharing power to dismantle those barriers that I talked about a minute ago, and holding ourselves accountable in different ways, being really transparent about where we have power, where we hoard power, and modeling that cultural humility that says we're going to continue to partner with those with lived experience, to honor the sovereignty of our tribal nations, to remain lifelong learners and critical self-reflectors on our work and our practice, that we're also making sure that we're mitigating power imbalances when we can and where we should. And when we can't, being really transparent about that. And so, I may be, kind of preaching to choir in some ways, because I know that as a part of this work, you all are really committed to advancing equity, but it being the center of our work, making sure that we're all on the same page about what child welfare is talking about. When we say a full equity framework, we are not just talking about training away a problem. And I would love at some point to come back and talk more about that, but Lacey's going to hurt me if I don't stop talking. Next slide. So we wanted to talk a little bit about some of the things that we've seen in the core goals of Raise Up Oregon that kind of align, I think, with where we're headed around family first and family preservation and our equity work. And so this first one being represent all sectors within the early learning system. And so as Lacey mentioned a little while ago, when we started the work of the Vision for Transformation, we really were paying attention to our communities, our cross system, and our tribal partners, really trying to lift up and understand kind of, where we had opportunities, where we had gotten it wrong, where they had already been telling us for days, months, generations about how we need to show up, and really thinking about our locus of control and how we can partner around system transformation. And so much like you all have done in terms of cross collaboration with your cross agency and community partners, we did that too in the creation of the Vision for Transformation. And so while the logos that you see on this slide are not fully representative of all of the people that we have engaged in this work, it's really important that we let everybody know some of the key partners that have been supporting this effort and are walking alongside us to support a transformation in our practice. Next slide.
I would just add one thing on that previous slide that I think is important. We sometimes in Oregon, in child welfare at least, have really been pretty isolated in our thinking. Historically, we've done things just internally. And what I love about this, both this visual, but also the work that it represents, is that we've really kind of flung open the doors to say, we don't have all the answers. We don't need to recreate what's been done in another state and done well, or where there's technical assistance or knowledge that can be helpful to us. Help us learn from what you've done, help us learn from your mistakes and your successes. And each one of those, including our 9 tribes, have really contributed to our learning. And I see my team growing in a new way as they get to interact with folks, their peers across the state or across the country. They bring a whole host of new thinking to us. And it's been really fundamental in some of the work that's happened over the last couple of years. Now I'm ready for the next slide. Thanks. I wanted to talk just a little bit specifically about next one more. This one's you, April. Sorry, I thought that mine was next. Go ahead.
That is okay. This beautiful image we are using to really think about our efforts around the Family First Act and our implementation of our approved prevention plan with the federal government, and wanted to talk just a little bit about what you're seeing. And so I could talk from the bottom up, or I could talk from the top down, but I really think kind of getting down to the heart of the work that we're wanting to do as a part of the Building Wellbeing Project is around prevention and stabilization and support and strengthening communities and coming alongside. And so you'll see that kind of in the bottom, those economic and concrete supports for families coming upstream, really working with our partners to not continue to provide, from a child welfare perspective, we have overly surveilled families. We want to make sure we're keeping that door really narrow in terms of child welfare, and then really working with our partners to say, how can we come alongside and serve families in a preventative way? And so when you see Oregon Department of Human Services, we could put the building well-being in there. We could put our Equity North Star, Vision for Transformation, but there is this entire kind of network of effort, including our Thriving Families, Safer Children effort, that is really about, again, that when we're mitigating those power differentials, we're saying we have hoarded power in some ways and resources, and we absolutely know and believe that communities understand what their children and families need, and we need to kind of lift up our hands and work with them and say, how can we be good partners, not the folks making all the decisions in the room? And so I think there's a lot of things that we are really trying to invest in, and the bottom part of that, I don't know if that's an iceberg or a pyramid, to say we've got to yield some of that power and authority. And so what you'll also see above ODHS is this greater alignment across child welfare and self-sufficiency. And so we know that many of the families that we serve would actually in child welfare would be better served upstream by our self-sufficiency partners, particularly given what the data shows us about the likelihood of involvement in child welfare is highly predicted upon whether or not you're socially isolated, whether or not you're experiencing poverty. And so really working across child welfare and self-sufficiency to really ask ourselves, how do we show up as one agency? How do we show up saying, how can we help you? And yeah, we know some things about safety, but again, how do we keep that door small and really saying across our kind of spectrum of services and supports, how can we serve families and prevent the need for foster care at all costs? And so that kind of gets me to some of these other levels around really supporting our workforce in shifting and understanding the network of resources, being able to admit we've got to learn to do kind of just a better job trusting communities with their most precious children, right? And so how are we listening and leaning in and humbling ourselves and being accountable and really promoting the values of our Equity North Star and committing to the kind of human dignity that it really requires to sit along and say, you know what, I'm here to help, but if I'm not the right answer, I'd love to, help connect you to the right answer. Or maybe I'm not the right answer. Maybe grandma's the right answer. Or maybe the right answer is the school, but we're still here to support that connection. So Lacey had mentioned, and we're really, really excited about this, as part of our Vision for Transformation focused on prevention. One of the biggest things that we're excited about is the launch of our Family Preservation Program, which our demonstration sites launched yesterday. It was such a fantastic and exciting day to be in, yesterday was the day before, Monday, to be in a space with our partners, not just our staff, our community who've been at the tables with us helping to co-create what family preservation really is going to be focused on, what it's going to look like. And so to see, literally, it was this, Zoom meeting with all of these faces and hundreds of people that had showed up committed to do this work together with us. And it wasn't just, some of the same old, age-old, all the social services people are there, all the system people are there deciding what they're going to do with the community. No, it was the community really stepping in and saying, no, this is what we want to do. And so that family preservation program is really about saying, can we serve families in home? Can we do much more in-home service delivery than needing to have out-of-home foster care? And what is it that we need to change about our practice? How do we need to humble ourselves? What do we need to change about all the things so that we can get to that fundamental space of providing preservation services. And so that program we're really, really excited about. I know I'm going to give Lacey a moment here in a second just to kind of talk about it. And then at the very top is kind of the Family First. And it's at the top in this hierarchy, and that is not meant to mean that Family First is kind of the, you know, the top of our priority. Really, family preservation and working on thriving families, safer children, that bottom of the, you know, of this iceberg is the heart of the work. It's a graphical demonstration of kind of how some of these things fit together. So I just want to call out that, you know, that based on this visual, it would look like Family First was the most important thing to us. But that act does give us some opportunities. So the Family First Services Prevention Act give us an opportunity to enhance services for children and families, prevent child abuse, prevent entry into foster care. A couple of quick things that I want to share about Family First. We have decided to implement as a part of our prevention plan a few evidence-based practices that you all will take interest in. We really are looking at parents as teachers and parent-child interactive therapy, motivational interviewing, just to name a couple. And then in future amendments to our approved plan, we're going to be looking at the implementation of a whole host of evidence-informed prevention services that are connected to mental health and substance abuse, that are connected to serving young children. And so we'd love to kind of talk more with you all about that. We also are going to be amending that plan to include tribal best practices like family spirit. And so we'll talk in just a moment about opportunities for partnership as we think about leveraging Family First to really focus on young children and the needs of young children here in just a moment. I'm going to stop and talk and hand it over to Lacey to talk a little bit more about kind of the implementation path for family preservation. And then we'll get towards wrapping it up so we can have some discussion. Lacey?
Thanks, April. Next slide, please. So as we really got into understanding Family First prevention services and the best ways for us to build infrastructure and supports to utilize them, what we realized is that this development of family preservation specifically was absolutely key. And historically, we have had child safety, permanency, and certification. And there's been a few local counties that have had what we used to call in-home units that we're now calling family preservation units. But there was no structure across the agency so that any family in any county could potentially be served in home instead of having to have their children separated for the purpose of foster care. And the connector between Family First and family preservation is that with those caseworkers who are serving families in home, they will be making the references and the recommendations on what Family First funded services will help support that family alongside other services and community supports that we have. We spent about a year over the last year working with an extensive governance structure to engage community, to engage tribes, stakeholders, and people with lived experience to really talk through what this needs to look like, and have gotten to the point where we have our first draft. It is not baked, it is not complete. We're going to use strong implementation science to allow for continuous quality improvement, which is what led to the 3 sites being selected and why we're only doing it in 3 counties to start out with. We've chosen a small, a medium, and a large county because what we've learned from prior implementations is that the dynamics of the communities, the dynamics of the makeup of the offices themselves impact how we need to have service delivery there. So we're testing it and have a strong commitment over these next several months for our staff, stakeholders, resource parents, people experiencing the system, to have opportunities to give us feedback about how it's doing and make some adjustments along the way. And so that we should have a more easily transferable program and service array as we move it out into other counties across the state. As April said, we kicked it off on Monday. It was a great day to be a leader in child welfare in Oregon. I was extremely just humble and pleased with the number of people that came, the way that our local leadership is partnered in the work. Just the volume of people that we had to come and hear about it. And we're going to continue to test it throughout this year. I expect over the next year that we'll be able to move it statewide. It may need to go as long as 2024, again, because we have given a commitment to truly being good implementers, and not trying something or thinking that we've got it all the way right without having opportunities for input from everyone experiencing our system. Next slide, please. So we see already places where we all are working together. In terms of the implementation sites for family preservation, where I think this is most impactful for early learning is that even though we have dramatically reduced the number of children experiencing foster care in Oregon, our largest age group is 0 to 5. So with that focus on family preservation, our partnership in serving those little tiny people with their parents is going to be really key. We already are also meeting around suspension and expulsion. There was an initial meeting with our team as well as ELD to discuss early steps for working together to address suspension and expulsion in early learning and childcare. We know for children experiencing foster care that they're likely to be more dramatically impacted, and really want that to be a focus as we really work on serving families in home. We also have 2 federal grants. One is CAPTA, because we love us a good acronym, Child Abuse Prevention and Treatment Act, and the other is CARA, Comprehensive Addiction and Recovery Act. And we have existing federal requirements under those 2 laws to refer children between ages 0 to 3 to early intervention when they've been a victim on a founded CPS assessment. And so I think we just have some opportunities to really think about how we strengthen and possibly expand these services with the help of you all, and really broaden what it means for family preservation as it develops. If you all have already heard some presentation from 2 of our program managers about that, and a lot of opportunity and energy around continuing that conversation. And then second, education outcomes and graduation rates for students in foster care. It goes without saying that when we have children who enter foster care and continue into the education system, they likely have gaps. And so, and some of what they experience and what their trauma causes from having been in foster care could even potentially widen those gaps. And so we can just see a lot of opportunity around early connections for early learning. So we have them entering kindergarten with a stronger foundation, and you can see the trajectories that's so key in getting them through graduation. And then with the whole department, we're working collaboratively with ELD on the transition of ERDC program to the Department of Early Learning, and developing joint family stability goals across ODHS, like you heard earlier. So we've come to the part of the presentation where we want to hear from you. Next slide, please. We'd love to hear, first of all, any thoughts or reflections you have on some of the information that we just shared, and then also some conversation about our capacity to partner.
Get off of mute here. Wow, thank you, Lacey and April, for a great overview. And Joel, will you just introduce yourself so the council members know who you are?
Yeah, thanks, Sue. Hi, everyone. My name is Joel Metlin. My pronouns are he, him, his, and I'm with the Director's Office of Oregon Department of Human Services, working on strategic projects. And I previously was in child welfare, also doing strategic projects. Thanks.
Awesome. Thanks, Joel, for being here. And I've been on a couple of other calls with Joel and the whole well-being project and initiative, which is another exciting part of what these folks are working on. So council members, I'll just open it up and see what comments you might add from your own perspectives, either professionally or geographically, and ways that you see we are working with child welfare, or that we could work with them more closely. Peter.
Well, I'm always glad to jump in, Sue.
Thank you. I appreciate that.
First, Lacey and April, thank you for the presentation. I just can't emphasize how much I'm delighted by the direction that this is moving in. I don't know whether you had a chance to work with Senator Bates when he was in the legislature, but this was something that he focused on for a number of years of how do we change the culture into one that wants to keep families together and that emphasizes keeping families together. And I love the approach to equity that ends with justice. I think that's a great step forward in framing the work. The cultural change is going to be extremely challenging. I love, April, your comments about it, that you can't train your way out of this. You have to change the entire culture in doing so. I think everything you're doing is going in the right direction. I encourage you a lot. I just had a question in terms of for the work that we're doing in Southern Oregon, the Strengthening Families framework from the Center for Public Policy, that's become really a easy thing for us to present to people. Just those core protective factors, say, hey, look, if we focus on these core protective factors, we're going to strengthen families. If we strengthen families, our kids are going to thrive. And that's kind of the simple, formula we put in place for people to try to understand it. So I just wonder whether that has influenced your discussions at all, the Strengthening Family framework at all.
It's interesting you would raise that, Peter, because some of our consultants have done some analysis for me on our current safety model, the way that we do case planning. And one of the things that we're missing in terms of assessment of parent capacity and need is community and connection. It's not something that we aim to improve. It's not currently within how we say that we're done working with families because we know X, Y, and Z has occurred. And what we've talked about is the protective factors and how they begin to move toward really understanding a whole family and making sure that we have created or nourished or offered opportunities for a family to be connected, right? Beyond just child welfare telling them what to do and then running away so they can be done with us. So as we're working through kind of the changes that we're making to how we're doing case decisions, right now we're starting with screening, but my intention is to move that work through the assessment process and then into planning and engaging with parents. And I'm not ready to say yes that we'll move to the protective factors yet, but it's definitely on the table and in the equation for sure.
Lacey knows I've got something to say about this. I think, I am a big proponent, and I have the benefit of being able to work in some other jurisdictions across the country that I think do this really well. And so I come in with some strong biases about tools and practices and approaches that really lift up the voice of the child and the community around a problem, as opposed to it being, we're going to focus on two parents and a child as if they're not connected to a tribe or a culture or a community. And so then we're holding, one or two people accountable for safety when they really exist within a system. And we have to be able to have conversations about safety with that system so that when we're gone or if we're never there, it's the community that's really supporting that safety. And so I'm really excited about some of the things we're doing around workforce development. I can come and talk about that another day. Don't get me going, but to talk about the workforce development infrastructure we're building so that we can support that focus. How are we lifting up the power of the child and the voice of the child, and really helping staff understand and listen to not only what they're worried about, but the things that help make them feel safe. And sometimes they might say something like, my grandma's tamales. And we have to be able to understand that culture and being connected to grandma's tamales is something that helps that child feel psychologically safe. If they are in placement and in care, how are we making sure that whether grandma is actively visiting with that child or looking on the screen as grandma cooks tamales or whatever it is, how are we hearing from that child about what they need to experience safety and really connecting with the community around that? And I could go on, so I'll hush.
I look forward to the continued discussions, April. I sent to Kali the article, and if you saw it in the Washington Post on Sunday, about the new president of the American Psychological Association. And what she's talking about is the same thing you're talking about, April. She kind of talks about it as it's a whole community mental health approach, a whole community well-being approach. And I think that's the direction you're heading, and I just really want to encourage it.
And Peter, are you seeing that in Southern Oregon actually play out or trying to set that up?
Absolutely. Think these are small changes, but I've talked about Rogue Retreat before, which is working with getting people off the street into safe campgrounds and into supported housing. And you see the changes when people feel safe, or they feel connected. So we're really looking at how do we build more connections. So we started to increase peer group participation. Just having a moms group for new moms makes a huge difference. So that's one of the protective factors in the Strengthening Families is what's the social connections network there. So it plays out continuously. If we connect people with something that's positive and help them feel safe and help them feel like they belong, they're making improvements in their lives. And we're seeing things like, graduation rates. I've talked about Phoenix High School before, graduating over 95% of their students, even after the fire that happened. It's because they prioritize making those connections. So we're seeing the effects of doing this work, of really focusing on those protective factors. Are the kids safe? Do they feel connected? Do they feel like they're important and cared for? So it does make a difference.
Yeah.
Chair Miller?
Yes.
I can't see everybody. Can I say a couple things?
Of course. Go right ahead, Kelly. Thanks.
Well, first of all, I agree with Peter in that this is just so exciting and exactly the right way to be. And I just want to give Peter a shout out, or kudos, as we say at CI, because the work that's happening in Southern Oregon is actually really special. It is very much a whole community approach. And I heard several times people talking about it's not those kids, it's our kids, and this interconnectedness of everyone in the community that I think is special, particularly in smaller communities, where you see the interconnectedness and you're focusing on strategies that integrate that awareness to ensure the well-being of all. And so I would just encourage the DHS folks to go out and visit what's happening in this region, because I think it's special. But that aside, I do think there is a lot of good work happening in Oregon. And so my wondering is how will my experience with DHS, and now I'm putting on sort of my hat and the work that I've done over the course of my career, particularly with the Black community, there isn't trust. And so I'm wondering how DHS is going to broker greater trust in this process. And if I missed it, I apologize. I was listening the whole time, but because I'm driving, I could not look at all the slides. But I think everything about what you're saying is exactly the right thing. And my only wondering is, how do you repair broken trust in communities? And I don't think the Black community is the only one where they're just, it hasn't been the case. And the disproportionality of kids taken from the home is high. So I would love for you to speak to that a little bit.
I would love to start and really invite others to join in. I think you're absolutely right. One, that practicing of cultural humility, of being able to come in and say, we're wrong. We haven't always done this well. And, and in some cases, we might have spots of spaces and places where people are feeling, well engaged and connected and supported and have built trust. And how are we building on that and highlighting that work and learning from it? We have to be accountable around the trauma, the historic trauma that communities of color have experienced, our tribal communities have experienced. And I've heard it loud and clear. I think all of executive leadership have heard it loud and clear. Don't keep bringing the same data back to us around disproportionality and disparity. We know about the data. What are you doing to move the dial? And so what we talked about in terms of the vision for transformation, we really need to kind of start from a place of, one, a full kind of review of our policies and our procedures, because of the ways in which racism is been codified, and to be fair, and we have to be able to look at the spaces and places where we're practicing that are contributing to oppression and do something about it today, and really get honest about that and transparent about that, as well as listening to our community. I also have a worry about going and asking the community the same questions we've always asked and asking them again and again and again. We need to look back. Where have we already asked the community? Where have they already asked us to do better? And how are we listening to that voice in our transformation efforts, so that when we come back to the community, we're not coming with the same information. We're coming with, we listened to you from 15 years ago. Here's what we did with it. Here's, so that's some of it. I think the third piece is we've got to engage community early and often when we're coming up with a good idea, because we've got to check back in to make sure, is this what you meant? Is this a good idea? That it's really driven. And I think, I tend to steer away from pyramid type graphics, because I think if it were my way as servant leaders, I think that the power really belongs with the community and that we're here to serve. And if we're going to flip that on its head, then we can't keep, operating from this medical mindset and medical model where we have all the answers and then we're going to come deliver it to the broken people. That's not right. We have to come to the people or look at where the people have already given us answers, and then come in partnership and say, we absolutely want to partner in different ways. We know that it's going to take time to rebuild trust, and you absolutely have every reason not to believe us until we start to show and prove differently. And so, the pandemic has done us no favors in us kind of getting out and sitting with community. And then the last thing I'll say is we can't always expect community to come to our tables. We have to get out there and be willing to sit in the fire and earn people's trust and respect, and, or maybe not, but at least be in the conversation and be willing to hear where we're getting things right, where we're getting things wrong, and hearing from people about how we could just do better. It's just point blank cultural humility, in my opinion.
I'm going to add one more thing, because April's probably too modest to do it. I appreciate the question too, Kelly. One of the things that's happened over the last 2 years since April's been in her role is she has facilitated weekly with our delivery program managers, with our district managers, with our teams, really, really fierce conversations about oppression, privilege. What does it mean to be an ally versus a co-conspirator? The vast majority of our leaders right now are white, myself included. The vast majority of our leaders probably are in the middle to upper class range of wealth, and they sit with a great deal of privilege. And it has been just incredible for myself, first of all, to grow and change, but to watch people who I've known my entire professional career change. And I think that it has to start with people making decisions in order for families to experience the system differently. We've also spent a great deal of time thinking about and talking about who we hire, how and why. And then third, I would say, in terms of putting our money where our mouth is, I think over the last year, 18 months-ish, there's been 4 major policy changes that have come about as a result of those conversations that we specifically say we're doing this to address harm that we've caused, places where we've unintentionally created disproportionality and disparity and unfair outcomes. So I think to April's point, a year isn't long enough and 5 policies isn't enough, but those are some of the things that are happening that I think are really going to drive change in the way that families experience our system.
Wow. Well, and I want to echo what other council members have said about my excitement and support for the direction you're going. And in other meetings, we've talked about this as well, especially with Lacey. And I just really congratulate you. I wanted to pick up on one of the comments that April made a minute ago about not expecting communities to come to our tables, but going to theirs. And I think that's a place where the Early Learning Council and also early learning in general, the programs can really help, because generally we're at those tables because that's who we are. In early learning, you are kids and families. So I would just encourage all of us jointly to look at how can we kind of take advantage of the early learning system as it's loosely configured right now to help with bringing kids and families and going to their tables. One other thing I would just mention, I was in Douglas County 2 weeks ago, and when we went to one of the very small rural communities, population 2,000, I think, one of the comments that they made was, we would love to have somebody from child welfare who can be consistently our connection, so that we get to know somebody and can build trust with somebody. So the only time we see anybody right now is when there's a real problem. So to the extent, and I know we all have staff turnover and huge workforce shortages right now, but I would say to the extent possible at the local level, to be able to have some consistency in who a small community connects with child welfare, I think that would go a long way in beginning to build those foundations for trust. And that may be obvious and go without saying. Other comments from council members? Yes, Peg.
First of all, I think the idea of culture change is essential. Having worked in child abuse for 25 years, it's so discouraging to see the intragenerational component involved in child abuse, and to look at DHS case reports where there's been a bad outcome, but there's been 20 reports. We absolutely have to figure out a way to identify families that need help sooner or perhaps are at risk. And I don't mean identifying people that are broken. I mean identifying families that need support to be successful. And it is, like I say, I have seen this work for 25 years, and I don't think we've gotten any better. I would hope we have, and certainly making some interventions early. I'm very pleased to see that people are going to identify kids that have experienced trauma at a very young age and get them the supports that they need, because those are the kids that then go on to have such trouble with social emotional regulation and ongoing problems. So I feel very strongly about that. I think we've got a system that really is broken. I appreciate the lofty cultural change, and it's absolutely needed, but boy, we've got a long way to go.
Yes, we have. And hopefully we're going to increasingly find ways in which we and the early learning system, as we pull other partners together, can really help with what you're trying to do with this transformation. So we definitely want to be partners. Peter.
Just a quick comment off what Peg said on the system part. I had a parent recently tell me, we focus on helping people build resilience. And her comment was, I wish I didn't have to be so resilient. I wish the system was resilient for me. So I thought that was just a good comment from a mom. Instead of putting it on the individual, it's actually on us to.
Yeah, I heard something similar was, it's not always about focusing on trying to make people more resilient. Let's make the world less traumatizing. How about that? And then another one that I heard recently was, it's not just about mandated reporting, it's about mandated supporting. And how are we really coming together to, know about the resources that are out there? And I think, to Peg's point, so much of kind of our workforce development plan is really around getting back to the heart of what a child welfare worker's role is. And I was brought up that it's, I'm supposed to go out and build communities build relationship with the communities so that families in crisis and in need have connection to those folks, so that I don't have to write a petition to go do something else, right? And so I think that's why there's so much energy and positive energy around family preservation, because it's such a cornerstone, and it's so much about community engagement that many of you are talking about at that local level. And if I can pick up the phone and make a call and help families get what they need, and we can support, kind of a collaborative of safety, then we're not waiting for a child welfare worker, right, to get to the thing, and that we're all kind of in a shared conversation about thriving children, right? And thriving communities. So I really hear what you all are saying about these partnerships. I had a couple of thoughts and I want to throw them out to you all about ways I think we really need your thoughts and partnership in this. The things that kind of came to mind, the fundamental respect for the sovereignty of our tribal nations is like paramount, because there are people and communities and cultures, nations that have always had the wisdom about how to care for their children and communities. And what we have not always done a good job of is helping our staff understand, and it's not just tribal communities, but I'm specifically talking about tribal communities right now, because of what we see in terms of our disproportionality with Native American, American Indian, Alaska Native children in our system, that if fundamentally our workforce and our systems are not valuing both tribal sovereignty and the value of and power of culture, we are missing the very heartbeat of thriving communities. And so I think to the point in question around, well, Black community doesn't trust child welfare. And so how are we leaning into the cultural wisdom that exists in those communities for how to take care of their children if there's no trust in our relationship? We can't learn from them if we don't first go and say, we've been wrong. And, one of the things that examples, and Lacey will laugh at this, when we talk about equity work, a lot of people want to focus on Black hair care. And it's like this thing that drives Rebecca Jones-Gaston and I nuts, because communities already know how to take care of their children's hair. They already know. But if we have a broken relationship with auntie and grandma, then we're not going to hear directly from them about how to care for that individual child. And so it does all come back down to, are we sitting in community, in spaces with community, listening and valuing their voices, and having them continue to be the experts on their children. And so that's one way, is just continuing to message that value and respect for tribal sovereignty and the wisdom from culture and community. That would be really, really helpful to us in child welfare as we continue to message that. Because again, what we know about public health outcomes related to young children and them coming into our system, if we can be engaging with community long before a call ever comes in, and we can respect and value that voice, you're talking about the doors of child welfare getting very, very narrow. A couple of other things that came to mind. We have been implementing a racial impact assessment tool on all new policies to make sure that community is at the table when we're thinking of a new thing or a new change. And no policy can get through, or no policy can be amended without going through that tool. So it's uncomfortable and it's pushing people out of their comfort zone, but they're forced to go back and say, who is most likely to be impacted by this change? And have they been involved and included in the decision-making and the planning around this change? And many other questions. And so that has already begun and has been in place for all new policy changes in child welfare. But we're about to launch a massive review, as I mentioned before, of all of our old policies to make sure that, so we're going to be coming and asking you all for some thoughts, because we are going to have to think differently about all the things, right? And so I want to encourage too, if in the organizations that you all are representing and the work that you're representing, that racial impact assessment tool work is a really powerful body of work. And whether you decide to implement one on your own or not, as we go forward in that work, we're certainly going to be wanting to partner with the Early Learning Council in that. So stay tuned, you will hear more.
We would love to be a part of that, April. It's certainly a priority for this council. So thank you. We appreciate the invitation to get to participate in that. And Angie, as a tribal member of Confederated Grand Ronde, would you like to make any comments in response to what April was saying?
Well, it's not exactly in response to what April was saying, but I do want to say how much I appreciate this emphasis on integrating community and not really just being about the child and the parents, but about that extended family, which includes the community. Oh, sorry about that. Let me phone ring. One of the things that we're doing in our community to really promote those protective factors that Peter was talking about earlier is through a grant called Launch. And I'm not sure if people are familiar with that, but it's linking actions to unmet needs in child health, particularly behavioral health. So we're using our Launch grant to fund a program community-wide to train all child-serving staff and parents that are interested in conscious discipline, which is a social-emotional curriculum. And so just all this talk about engaging the community and protective factors, it's very exciting to me. And I know our tribe is doing a good job in moving in that direction, but there's always room for improvement and continuing to work to build that. One of the things I struggle with here at Head Start, I work for the tribe and I run the early childhood programs. And one of the things that has been a challenge for me is, how do I work with those extended family members for families that are struggling? So we see the struggling and we want to pull in, who's your support network? We want to pull in the aunties and the grandmas and, the neighbors, whoever they are. And it's hard to do around the framework of confidentiality. And how do you reach out and get everybody to the table that could offer that support? Just something I've been thinking through for a while, but this conversation is exciting to me. I appreciate it.
Angie, I've got something to share with you. Let's connect afterwards. There's a tool, a framework. It's brilliant. And it's exactly what you're talking about. My little statement is no network, no plan. And it's a way to bring that network in to and around that child based on their needs. So let's talk about that.
And
thank you.
I would just add, myself, my team, and our child serving system are learning from Angie and Grand Ron. They're years ahead of us in terms of family preservation. Their tribal members come to their child welfare office and ask for help. They have a wait list to serve those families. I mean, they are mountains beyond us, and we have so much to learn, and they've been really gracious with sharing their learning with us.
Yeah.
Yes, we'll do.
When I was in Douglas County a couple of weeks ago, we met with Cow Creek tribal members. And once again, they're so far ahead of many other parts of the system. So we have a lot to learn from the tribes. You're right. Alyssa, do you want to make any comments from the Early Learning Division perspective?
I had to miss most of the presentation, so I apologize. I'm really excited to go back and listen to it. But even just the few minutes I've been back, really excited to hear and thinking about all those connection points that we can be making to stay coordinated, and thinking back to our previous conversation about early learning hubs as well, and just how we are systematizing that coordination, how we are putting that resiliency back on the system and not on the individual. So April, I will definitely follow up, and I'm really excited. And so especially as we're again growing this agency and redefining the way we do business, I think it's a perfect opportunity to take great lessons from tribal nations, April, from what you're doing with ODHS and kind of systematizing racial justice and racial equity. Now's the time to infuse that across everything that we're doing. So I just see a lot of opportunities for coordination going forward.
Yeah, that's a very exciting time. I certainly agree with that. And yeah, so many ways in which we can partner. And we will continue to have this conversation even offline with you, April, and Lacey. And I'm sure that Joel will be a part of it as well as we explore ways that we can work together. As you get to know the members of this council, the non-agency director members, I'm confident you'll get a sense of where we can be sort of resources for you as you explore, how to go down this road together. George Mendoza was superintendent of the LeGrand school system. Schools are going to be a critical part of this. We know they're a touch point for families, all families. So And I know one of your pilots for the family preservation lunch is Douglas County, which happens to be where Anne is sitting and spends a lot of her time and energy. So just look at us as resources for you, even individually, as well as a council and as a body. But I know we are at noon, and I want to thank April and Lacey very, very much for the presentation. We're all obviously very excited. And Joel, thanks for your leadership in implementing a lot of what's been talked about. So council, we will take a 30-minute break to grab some lunch and something to drink, and we'll see you at 12:30. So thanks, everybody.
Thank you all.
Okay. Afternoon, as we all gather again. Wow. A very exciting morning we've had, I'd say. Very full. There were lots to think about, lots to debrief at our next meeting from what we heard from ODHS staff. And we're going to have a great afternoon as well. I see John is on, which is good. Welcome, John. Thanks for being with us.
Good afternoon.
We'll wait a couple more minutes as council members reconvene. Kali will be with us around 1 or 1:30. And she's the only council member I know is going to be delayed. So, John, it's interesting that you haven't been at the meeting all day, but the whole social, emotional, behavioral network and workforce concerns keep coming up in sort of every conversation, both with OHA and with ODHS, and it just sort of weaves in and out. So we will be excited to hear your update on the specific consultation model, but I have a feeling we'll also be interested in how are you going to or already relating to all of these different strands that are out there. And Carrie McCann is with us too. Everyone knows her from the BUILD initiative. But she is also a very critical player in the social emotional development of that program. So Peter's on, Kali is tied up, and he should be back. Are we waiting for Alyssa? Do you know, John or Remy, or not?
Alyssa is going to be back at about 1:30. She has some interviews going on. So,
oh, that's a good sign. With 64 positions to fill, we're really happy to hear that she has some interviews going.
I don't know if it's a job interview, Sue. I think it's actually a public relations OPB kind of thing. So, which is also very exciting.
Okay, well, good. Okay. Just see if I can find a couple. I just want to wait a couple more minutes to see if a couple of these council members jump back. Yeah, I share, I'm looking at the chat, a little late, but better late than never. And appreciate your request, Peter, for that network tool. Yeah. Yeah, those kind of conversations are obviously so exciting, just to see the connections that we continue to make. And I hope none of you is concerned that I offered each of us individually to be working with OTHS. I took the liberty of saying, call us anytime. So hopefully that won't be overwhelming. I'm guessing it won't be. Okay, well, I'm guessing we will see, Peg said she'll be here in a couple of minutes. So let's go ahead and get started because we've got a lot to do in the next hour and a half. Next on our agenda, as you know, we have public testimony. And my understanding from Remy is that nobody has signed up for that. Is that still correct, Remy?
Yes. Well, yes, that is correct.
Okay. All right, then we will move on with our next presentation, which is obviously from John Reeves, who's our fabulous staff person, Community Systems Team Manager at the ELD. And this presentation is really an update for us. And also we wanted to make sure that anyone in the public who's tracking this program development and interested in getting updated on it would have this opportunity to listen in. And obviously this is being recorded so they can listen later as well. But it's a very important program that seems to intersect in lots of different agencies and different ways because of the focus on behavioral health broadly, with workforce being a big part of it. So I will turn it over to you, John, and thank you very much for being with us today.
Good afternoon. Thank you, Chair Miller and members of the council. For the record, I'm John Reeves, and I am the Community Systems Team Manager at the Early Learning Division. And it is exciting to be able to give you a progress update on the Early Childhood Suspension and Expulsion Prevention Program and some of the additional progress that has been made to date. And I think that if you'll indulge me just for a second, I'd like to take just a moment to introduce part of the progress here, which is actually Katrina Miller, who's on this meeting with us. She is our new infant and early childhood mental health specialist. That's a mouthful, but she is the primary position leading the work and the ongoing development and implementation of this program. And she's been on board with the Early Learning Division for so long, I can count it in minutes. It's about 210 minutes. And so today is day one, but if you wouldn't mind, I'd like for Katrina to just be able to introduce herself to the council.
Absolutely. Welcome, Katrina. We're delighted to have you here and on the staff.
Thank you. I am so excited to be here. I have worked in early childhood mental health consultation and early childhood systems for a lot of years. I was previously at Morrison Child and Family Services. I've touched a lot of different types of early childhood systems. And so I'm really excited to be here and help build out this program and really help keep kids in care and in settings that want them to be there. So
awesome.
I will have to step out a little bit early. I have an obligation at 1 o'clock. So I'll have to log off just a few minutes before that. So John will field all of the hard questions, but then I'll come back around on another time.
Okay. Thank you, Katrina. And really, we're very excited to have you with us.
Yeah.
We have a lot of work to do, and it's going to be a very exciting year.
Yeah, thanks, Katrina, for giving a brief intro, and we are extremely excited to have her and her expertise on board at the division. Remy, are you able to share my slides? Great, you're fast. Yeah, I was hoping Katrina would be here for all those hard questions, but we'll see how fast I can talk. So if you can go to the next slide, Remy, that would be great. Just want to give a little bit of context again and a reminder that we're giving some updates on the purpose of House Bill 2166 and the work that we're doing to implement it. And that bill establishes the Early Childhood Suspension and Expulsion Prevention Program with the goal to reduce the use and disparities of use of suspension and expulsion in early childhood care and education settings. And the bill requires the development of technical assistance providers and infant and early childhood mental health consultants that will be working very closely with the early childhood education programs to meet the needs of the children and the adults that are working with them. I kind of wanted to mention something related to what Chair Miller said about the cross-system applications here. I really think it's important to stress that suspension and expulsion and the utilization of that as a practice, it's actually lagging indicators of a lot of different things and different factors. And it really is a cross-system set of strategies that we need to put into place that relate to everything from housing and food security to health and well-being services for families and compensation of early educators, having systems in place to support early educators so that they can have a substitute to get out of the classroom for a little while, really thinking about high-quality professional development and support systems so that we aren't seeing some of the things that occur that manifest in terms of children experiencing, exhibiting behavior concerns in the classroom and how that affects the adults that are interacting with them. And so it really will require some multi-agency efforts and some mutually reinforcing strategies. And this suspension and expulsion prevention program is an excellent and effective evidence-based strategy, but it's only one strategy that will need to be implemented to truly support the needs of the early educators and the children and families in programs. And just a reminder that Senate Bill 236, which is very tied to the work of the Early Childhood Suspension and Expulsion Prevention Program, which institutes a ban on suspension and expulsion, more of the rulemaking and development of the strategies to help address, all of the strategies help address that bill also, but really thinking about the rules that might go into place closer to 2026 when the ban on suspension and expulsion would go into effect. We want to make sure that we're able to learn from the resources that we're able to put into action around developing this infant and early childhood mental health consultation, really think about how well those strategies are working for early education programs to help inform how we put together the strategies that really will reinforce that the ban on suspension and expulsion. Next slide, please. And so just to give a quick nod to some things that have occurred pretty rapidly in the last month or so. And I do want to mention that I kind of talk back and forth between two things, the Early Childhood Suspension and Expulsion Prevention Program and infant and early childhood mental health consultation. Both of those things are tied together within what is to be put together to support the requirements within House Bill 2166. And on February 1st, we received the little picture there of the Centering Racial Equity report that was resourced by some of our preschool development grant funds that Portland State University's Early Childhood and Family Research Department did interviews throughout our state and nationally. They conducted interviews with early care and education providers, early childhood mental health consultants and consultants of color, culturally representative leaders throughout Oregon, and really had a focus also on getting some voice from our rural area partners and from our tribes. And there were about, within that report, 76 individuals participated in 47 one-on-one interviews and 5 focus groups that culminated in a robust set of recommendations that we're using as the foundation for developing the infant and early childhood mental health consultation model. And it really, truly, the report centers race, culture, and language at its roots. And the reason that we're truly focusing on that is because we're working to change the trajectory of what we know to be true, which is that children of color and children with identified special needs are asked to leave care at much greater rates and are suspended and expelled from early education programs much higher than their other children that are white in those programs. So this report is fundamental to the program that we're developing, and you'll hear a lot in the next slides and see a lot in the next slides around the components that we're working to implement and developing currently. On February 9th was a really exciting day where Alyssa Chatterjee and I were able to present to the Ways and Means, and we gave a progress report on the development of the model, and that's when we received a green light to access the additional $5.2 million that we're relying on that report back to the legislature. And so we now have access to those funds to help build out the programming that we'll be talking about today. And we are also in the process of hiring 2 more positions at the Early Learning Division to work alongside Katrina. And one is being recruited for shortly, and the other will be open soon. One is on our grants team to support those grants out to communities and our regional entities that'll perform infant and early childhood mental health consultation. And then one will be on our policy and research team, working with David Mandel and his team. Next slide. There we go. So this next slide and the next several slides actually reflect the elements of the Portland State University's report that really address the legislative requirements and really also honor the intent of the Racial Justice Council work that center equity and what will be the foundation for the program that we're developing. And the recommendations, I would like to stress that the community members and providers of service that gave their thoughtful input to this report really are the recommendations of people that have really given us quality feedback on what they believe is truly necessary, and that it was stressed that if we don't make this type of investment and really think about equity from the beginning, that the model won't be successful, and that we take our time to do it right, and that we really want to be utilizing those recommendations at the heart of what we're working towards. So an example of how this process might work, just because using some of the terminology, you can get lost in that around, what are we really talking about here as we're thinking about suspension and expulsion prevention. A case scenario might be an early childhood education provider might be struggling to support a child in their care. Or the provider is realizing that they'd like some support because they're not quite sure how to support a child, and they might be exhibiting some behavior concerns. So they would make a request to what we're calling a warm line. They would request help. The warm line will be available statewide. It will refer that early care and education provider to one of several potential consultants. That could be existing training and technical assistance providers in their communities. It could be the mental health consultants that are being mobilized and as part of the program that we're developing. But we really will be working to coordinate with regions locally so that technical assistance providers from child care resource and referrals, infant toddler specialists, early intervention, early childhood special education consultants, partners at the Inclusive Partners Program, and consultants doing infant and early childhood mental health consultation will all be working with common approaches, shared assessment and observation tools, communication protocols. We're imagining as we're developing this that there will be shared professional development amongst those consultants, that they're collecting similar data elements, and when necessary, working on shared case management in working with children and families and early education programs. And so the reason that we really want to leverage what exists and add new resources in this mental health consultation model is that there is always going to be a need, and it's always going to be more significant than the resources that exist. And so we have to maximize on every type of consultant and technical assistance provider that we have. And so as a request is made, there will be partnerships with those regional entities that will help to ensure that somebody takes point to go out and respond to the program's need. And these communication strategies will decrease, it'll help decrease the coordination and management that has to occur on behalf of the early care and education provider. We don't want them to have to be flight control for all of the consultants that might step up to their door and knock and say, I'm here to help provide services. We want to make sure that that coordination is done on a level that it's seamless on the back end for the provider to have access to high quality technical assistance, training, and coaching. And so at certain points, there may be handoffs between consultants to support that provider as the needs are more accurately identified, and services may be diversified to support the children and the families in the program depending on needs. Next slide.
John, let me just ask, are you okay if council members have questions as you go through these slides to be interrupted, or would you rather be able to do the whole presentation and then take questions?
Thank you, Chair Miller. I think I can take questions on the fly and maybe keep my train of thought. So absolutely, and feel free to interrupt me. I can't see the chat as I talk too much.
Yeah, no, that's fine. Thank you, John.
So, John, I do have a question, and I bet you know what the question is, because I'm sure everyone asks this: where does this workforce come from? How do we create this workforce that's going to be able to fill this need?
I appreciate the question, Representative Buckley. As we're imagining this, we believe that we are going to be building our workforce along the way. We have, there's one slide here, but I definitely think that it will be interesting for the Early Learning Council to see a little bit more of this data. But we have had the opportunity to work with the BUILD initiative to do a workforce survey of the existing infant and early childhood mental health consultation workforce around our state, and had 65 responses from current consultants, and we were able to understand some of the pathways that those consultants took to get to the qualifications that they have, and to and some of the support systems and opportunities that really help them to be able to be in the roles, or to actually decide to change a role and get into this line of work. And so that data will have a final report in April that I think will be really interesting for the council to think through some of the ramifications of it. But it's understanding some of that data and thinking through, knowing where and how people who are currently in the work came to be in the place to do the work is helping us think about the pathways that we want to develop out. And so we are really thinking about ways that we can create professional development pipelines and accessibility to some of the degree programs and certifications that exist out there. We're thinking about ways to partner with entities who want to pilot some opportunities like access to the infant and early childhood mental health consultation certification through Georgetown. We're thinking about putting together a cohort that would be able to help us learn some things about how well that will be as one of the potential opportunities. And then we also have some higher education scholarship funding that we are already working to mobilize, but that will be accessible to professionals that are working towards their qualifications to be able to do this type of consultation work. And we have some models that we call consortium models that really try and tailor the education approach to the professionals at times that are accessible to them, in addition to paying for the costs of those opportunities. So we'd like to replicate some of those things to be open and available to the workforce that's working towards attaining the qualifications to do this work. And so we're thinking through all of that. I wouldn't say that we have all the answers yet. And the Higher Education Coordinating Commission is another group that we're working with around multiple sort of early education pathway conversations. And this is one of the tracks that we really want to, build opportunities in.
I appreciate the kind of all the above approach, because I think it's going to take all the above. I'm wondering if you're coordinating with the with OHA and the coordinating care organizations as they're developing the metric for social emotional learning for children under 5. Part of their work is to do the asset mapping of every region in terms of what we have to support social emotional learning. Are you working in alignment with those folks?
That is definitely part of the plan. I wouldn't say that on the state level that we've had the tangible conversations yet. We've been in some of the local coordinated care organization conversations as they're thinking about the social emotional metric, but also there's a few regions that are working on some early childhood mental health consultation approaches that align with what we're working on too. So we're really trying to make sure that we're complementing the work that they're trying to achieve, but we really do believe that that our work needs to align up with the social emotional metric. But that's some of the work to come. But I appreciate that you're highlighting it, because I think it is critical. But we haven't gotten into the deep details of that yet.
Okay, thanks.
I'll keep going, and definitely interrupt me if there's other questions. And I may start to repeat some of the things I just said because Representative Buckley beat me to one or several of my slides, but we'll see. So in this slide, I just wanted to start to give an overview of some of the elements that we're taking from the PSU report and talk about sort of how this structure will exist and what we think the ideals are of how the model will work. And so the scope is ultimately of the early childhood suspension and expulsion prevention program. We'll have consultants that are preventatively working with early care and education programs. And once it's really well established, really the intent is we don't want to be focusing on emergency response and emergency issues, although we do know that right now, we could be out there with consultants in the field responding to the various needs that early educators have to support children that are in their care. But we want to get to a place where this is really building extensive relationships with early care and education programs, working on building skills and competencies of the workforce, and walking alongside them over a period of time, not just in sort of emergency one-off interactions. And so we want this program to be flexible. There will be some standardized or centralized components. Some of the examples of centralized components will be clear expectations, including things like theory of change, mission and vision, logic models that are focused on anti-racism and trauma responsive practices, really thinking about how we can address implicit bias and hold ideals for inclusion of all children as the standard. The warm line function, professional development, evaluation, data collection, and things like standards of practice will all be part of that centralized focus. But we really also, at the same time, want to incentivize flexibility of the regional services so that the culture of the communities, relational approaches, the types of organizations that may lead the consultation, and especially that the needs of the children and how we address that are all individualized approaches. And so the report recommendations and what we really want to deeply install into this model is that we aren't going to do this in the way that we might have done it before. We really want to consider thinking through this differently. It may look different in one region over another, with equity considerations at the forefront. It impacts the timing of how this rolls out, and it will potentially diversify the organizations that are selected to provide this local consultation service. And consultants will be trained to provide support to programs, classrooms, children and families, but just I want it to be pretty clear that the real focus here is working alongside the early educators as the foundation for the focus of the work that these consultants do, really helping early educators to build the competencies and skills to work with their children through within the context of the family, within the context of their community and their culture. Next slide, please.
John, can I just ask one question? There was something on an earlier slide that suggested that these warm lines would be available not just for the child care providers and the educators, but even for families. Are you making them that accessible?
Well, we do not want to limit it so that a family couldn't make the contact around this to say that their child needs some support, or that their child may have experienced suspension and expulsion from a program, because if the family engages through the warm line, then I think we can connect them to resources to either help them in the current environment that they're in and work with the early education program, or make sure that we're helping them on a trajectory to land in another program if they've experienced a situation where they have been expelled from a program. So we didn't want to close that door, because it may also be a really important data point for us to learn what's going on out in the world of early childhood at the moment. And so we are keeping that as a component that could exist within the warm line.
Got it. Thank you.
Let's see. So around this caseloads and duration slide, we really are thinking about ensuring that these mental health consultants have very low caseloads. We're striving for an average between 6 and 17 programs at any one time. That was pretty consistent with the data that was gathered by PSU and some of our national entities. Of course, there are definitely programs that have larger caseloads, but it definitely was stressed that engagement should be over lengthy periods of time, with no less than 6 months of opportunities to visit with programs, even 1 or 2 times a week. So we are talking about an intensive dosage and a relationship that's being built to really support the early education program to provide high quality services to the children and the families. And so we want to also ensure that that these are targeted services and that we're able to reach even the smallest early education programs out there. We want to make sure that family child care providers who may not know about these services or may not be aware that there is an opportunity, we want to ensure that this isn't all just sucked up by larger programs that have been aware that it exists or know that it exists more. The approach will be to ensure that there's equitable access across all types of childcare programs. And then supporting readiness, we really want to clearly lay out the goals and the role of the consultant. So the consultant knows what their role is, but also so that the early care and education provider really understands what is expected of those consultants, and then what is expected of them as the early care and education provider in that partnership. And the model, I want to stress, is not about fixing the children in the program. It's about examining the environment and the approach to learning, and what might contribute to what the early educator and the child is experiencing. And so we really want to stress up front that the early care and education providers are prepared that we're going to address implicit bias, racial equity, and that it'll be central and mutually understood and consistently addressed throughout the development of that relationship between consultant and provider. Next slide. This gets to some of the things that Representative Buckley was inquiring about, but comprehensive onboarding is going to be very necessary, and it will need to cover a wide range of competencies and skills for these consultants, spanning areas of professional consultation, psychology, social work, health, behavior supports, early education, mental health, of course, and also family systems. This is a multidisciplined approach. We really are, as we're imagining that we are opening up the accessibility of some of the education opportunities, we believe that we'll be building expertise in our workforce over a period of time. So we really want to ensure that that lived experience is a celebrated and valued qualification of our consultants, that they reflect and represent the communities that they come from and that we're trying to serve. And it did come forward in the PSU report that a master's degree is highly necessary, and felt even by consultants that are doing the work, that they felt that it was a very complex and multidisciplinary body of work, and that they needed that level of education as their foundation. So I think that's what our aim is with, as we said, trying to open up all the pathways that we can find to help people attain qualifications that help them develop the skills and competencies to do this work. We do not believe that everyone has to have clinical licensure to do this work, but we do want them to have robust cross-discipline experience so that they can draw from that in the work that they're doing. Next slide. And to not fully repeat some of the things that I said in answer to Representative Buckley's question, I think that this is a slide that is really around the ideal that we are building strategies to increase the diversity of the consultant workforce. And it's going to take a menu of opportunities to address workforce at all levels, but we really want to think about this for not just consultants, but at the supervisory and leadership levels, ensuring that consultants of color have reflective supervision from people from the same communities and cultures. And I just want to stress that this work is not about building a therapist or a behaviorist, but instead we're really looking at opportunities that we can build on the strengths that people have, really thinking about their reflective capacity, their relational quality, people who are able to display humility in their approach to their work, and build in opportunities for on-the-job professional development, financial supports to get some of the barriers out of the way that relate to not only their education, but some of the other expenses and living expenses that they have in order to set aside time to do this work, and to go to school for these qualifications. We want to have internship opportunities that allow for growth and skill development while people are working in these organizations that they're in. Next slide.
So John, can I back you up 1 minute and just ask you a question? In the $5.8 million that the legislature released for this program development, is some of that going to be used to, underwrite some of the expenses that were just listed on that last slide, like scholarships, financial aid, wages, et cetera?
There is a potential for some of the funding to be attributed to some of the professional development components, but we are also imagining that we have within our professional learning system funding some additional ways to scholarship some of the higher education costs. And I think what I was alluding to before is also working with the Higher Education Coordinating Commission around a few strategies to add additional higher education scholarship opportunities to really address all the wraparound barriers that may exist. But we do have some funding to support some of those strategies, not only in this $5.8 million, but within some of our other professional learning funds.
Okay, great. And Council, I know an update on professional learning in general is coming up, I think either in May or June, if I remember correctly. So hopefully that'll be a part of it. Thanks, John.
I've taken a note because you'll have to see me again to hear that presentation. So thank you.
We will welcome you back.
Thank you. And so this slide is again stressing that there's intersectionality here between gender, age, ability, implicit and explicit bias, and that it has to be a focus within this system building to combat against the disproportionality that contributes to suspension and expulsion rates. And I think we're seeing some other things on the slide deck. Some, maybe Remy, is that some of your, yeah, there we go, it's gone. Not that everybody wanted to read my words, but they might not have wanted to check out a file structure in a computer, but thanks. At the same time, we're really wanting to focus on building distinct skills for our current consultation workforce. As much as we want to diversify the workforce and are working on those strategies, we want to support our existing consultants to deeply understand the histories and current contexts of the communities that they serve. And while we're actively working to diversify the workforce and add more people to the workforce. Next slide. And just wanted to talk a little bit about some of the focus that we're moving towards with the rulemaking, which is coming very shortly. The application for the Rulemaking Advisory Committee closes on the 8th of April. And I just wanted to give a few highlights around this. So the rulemaking will cover, again, the foundational aspects of House Bill 2166, and supporting the development of a system to reduce suspension and expulsion prevention, or to reduce suspension and expulsion. The rulemaking in this process will generally focus on a couple of principles, but if it's a requirement that will be of the early care and education programs, we just simply, that is the type of thing that would live in the rule. If it's a requirement of what might be in a grant to a regional program to implement the mental health consultation, those requirements would live in things like the contract with that entity, the standards of practice, or operating guidelines for those programs. And so the infant and early childhood mental health services that are provided within the program are specifically for early care and education programs to access, to help them maintain children in their program. And the law passed within House Bill 2166 requires that programs that are registered, so early childhood programs that are registered or certified through the Early Learning Division, and also programs that receive public funding, need to request access to the services that will be provided within this program. And so there will be a rule that describes the requirement for early care and education providers to reach out and access these services that will be available to support them in their programs. And the rules will most likely also establish a grant-making program so that we have a mechanism to create the infant and early childhood mental health consultation in regional communities throughout Oregon, potentially defining the eligible entities that may apply to be the local regional service provider that has the mental health consultants that they're mobilizing to support early care and education programs. And the rules will definitely cover the establishment of the suspension and expulsion prevention system with common definitions, significant terminology and expectations around things like racial equity and implicit bias, anti-bias and anti-racist practices, trauma responsiveness, inclusion, and then really describing the various types of terminology that fall under exclusionary practices. We want to make sure that everybody understands what we mean when we're saying suspension, expulsion, soft expulsion, using strategies like trial periods where family would then be told that their trial period's over and they don't have care anymore. We want to define all of those things so people really are cognizant of the types of supports that we're trying to put in place to support not only the early care and education provider to do the work that they're doing, but also to maintain relational care for young children so they're not bouncing from environment to environment. Next slide.
And let me just say to all of us that we are running out of time. So we're going to need to really fast forward to the extent possible, John.
I am more than willing to not speak a lot more. So let me wrap up for you. So in these last slides, I just wanted to mention, like, there is significant outreach and recruitment for the RAC. And we are hoping to ensure that we can recruit representation of parents with children with disabilities and parents who have children that have been suspended or expelled. We want to ensure that we have early care and education providers, early learning programs, community-based organizations, and culturally specific service providers, and really ensure that we have a wide diversity of and range of participants throughout Oregon. And so, go ahead.
So a part of that list of outreach is asking some of those partners to refer parents.
Absolutely, yes.
Okay.
And we are definitely seeing a good mix of applications coming in already from parents and early care and education providers and some of our partners throughout the state. And so just
Council, this is a place where we all can help. If you have suggestions of parents or key people who would be really helpful on this RAC, please send them to John or me or whomever right away. Okay, thanks, John.
And actually, I think, Remy, if you would fast forward to the last slide, I think Chair Miller just sealed the deal. We really just wanted to stress that if there's still time, if you know of people who really would be a great representative to have on this rulemaking advisory council, that we'd love to have you send them to the link on our website and get them into the mix before it closes April 8th. And I think just two more slides ahead, and I'll stop and take any more questions. That slide gets at that workforce report that we will make sure that the council has access to. And then the last slide is around the timing. And it's a very condensed timeline, but also if you could move forward one more, it just gives a picture of, we really want to make sure that by February of 2023, that that is a timeframe where regional contracts are in place, and they're working towards those regional entities are working towards hiring their workforce and mobilizing the resources that we're able to provide to them to start to provide the mental health consultation to early care and education providers. And you can kind of back your way up through that timeline to see that we're going to have some other great opportunities, and are building a list of folks, if they aren't able to participate in the rulemaking advisory committee, that we will have some other engagement opportunities that they can help advise the development of some other components around the program. And so I will stop there and take any additional questions, but really appreciate the time.
So John, looking at that slide for another minute, Remy, if you'll put it back up. So with the rulemaking, which is where the council needs to weigh in, it looks like that's supposed to be done by, I think it said May or June. So is that a hard stop that we have, or what are the requirements on timing?
And I can say some things, and Remy can correct me if I'm off on my own version of this, but we are hoping to bring the rules to the council at the June meeting. And so we would like to conduct the engagement opportunities throughout the majority of May. And so, but as far as it being hard and fast, the timing that we're trying to align with there is to have the important components in place so that when we get to implementation in early 2023, that those rules are established. But
okay,
I would imagine if we had to, there's flexibility to.
Okay, thanks. Just wondering. Council, any quick reflections, questions? George?
Thanks, John. Just quick thoughts. I'm a superintendent, and I was an elementary teacher, and then I was an elementary principal. So a lot of the things that you were going into for me were kind of putting in my school experiences or training. So some thoughts are, as you get into the council or the PAC group, the group that's working with you for rulemaking, to me, any Head Start program director, any Head Start teacher, even kindergarten teachers, or even an elementary principal that does a lot with primary grades, would probably give a lot of feedback or support on at least some type of accountability or accountability systems that people put in place. For administrators, they take a lot of courses, and they do take courses on discipline or behavior management. And to me, it was also this, if there are classes or there are courses or there are systems in place for program managers or Head Start teachers or preschool directors to have to take a course or courses that on management or behavior management and the style or the structure of the restorative justice practice or whatever it might be that we're trying to do. The other side of me in all of this was kind of like, I wonder if it's going to become that schools start to have more rules about non-expulsion or not suspending and I know that there's a lot of, I'll just say, lived life experiences and different biases that we all have. But at the end of the day too, we still need structure, and we still need order, and we still need discipline, and we still need accountability. I mean, I'm in a school system, and I'll just say right now, we're having things right now where truancy went away. So now there's no real accountability except the schools to tell a child and a family, we need you to attend school regularly. And the legal system is no longer a part of that. Not that I need a child to get a ticket or a citation, but we need help sometimes to get people to have the right skills. We went away from vaping, and we went away from drugs too, in terms of that for a legal consequence, which is fine. But at the end of the day, now it's like, Now kids can come to school and do all these other things, and we can suspend them and we can expel them, but there's no other, I'll just say there's not another judicial thing that helps, or there's not another health care system that helps as much. So we're going to create second order and third order problems when we get too loose. So my point in all of that is structure is good, and we need to keep remembering that too. And not enough structure also creates a lot of other problems. And so when you said something about, it's not getting into the behavior of the child, well, we have to get into the behavior of the child when it's causing a severe disruption. And we've got to do different things to figure that out. So I guess I'm learning and I'm listening, but I'm also in that like, I hope it goes in this way that's kind of in the middle, not too far here, not too far here. We got to do something better. And I get that, but throwing out everything would probably be problematic for me.
I appreciate that. Is it okay if I respond to that?
Yeah. Oh, yeah. Go ahead.
I really appreciate your lens around this, George, and on the front end of your comments. If you think of any great people who have been implementing some good strategies in the early education, early school education component that might want to apply to be a part of the RAC, we would definitely consider them also. And Head Start and Oregon Pre-Kindergarten programs are part of our recruitment strategy, and so that we have been doing outreach to them too. So I just appreciate that. But then on I think whichever slide I might have said something related to something that made you feel like there was maybe too loose of requirements, or that we weren't focusing on behavior. I might have just spoken in a way that it didn't land just right. And I do want to stress that we're really trying to build the support system for those early educators to support children to de-escalate behaviors that they're experiencing, but also build the skills of the educator to provide robust professional development, which we have some good opportunities for early educators to get some professional development to understand the best strategies that they can utilize to support children, but we don't have enough of it, and it isn't widely available for all types of care providers or in all languages that would be necessary. So we're really trying to build the system of supports that help them do their job better, but not trying to make things more difficult for them. We're actually trying to add resources to the system to support them.
Okay, great. Thanks, John. Thank you, George. Council, we need to move on. John, thank you very much. We appreciate your being with us. Congratulations on hiring Katrina.
I'm so excited.
You are beyond excited, I'll bet. And we'll look forward to talking with both of you more in the future. So, and thanks for your leadership in this. It's big.
Thank you so much. I appreciate it.
Council, we have worked right straight through what was supposed to be a listening session update. And Carrie and I agreed offline that we would let that conversation with John go. And what I want to do, we need to do is jump to the rulemaking part of our agenda, because that is the official duty and action that we need to take today. And then we'll see if we have any time at the end of that meeting for Carrie to give us a 2 or 3 minute update on listening sessions, or mostly where we're going. So with that, we are going to go to, if I grab my agenda here. I think, are we starting with Jay? Alicia. So we'll go to the rulemaking, which, as you know, is agenda number item 8 on our agenda. And welcome Alicia Gardner back. We've seen you before, and Alicia, we appreciate you being here today.
Good afternoon. Thank you, Chair Miller. Members of the council, I am Alicia Gardner, Acting Office of Child Care Director. It's nice to be here, and an honor to be here again and see you all again. So Office of Child Care is requesting that you review and adopt 2 rule changes today in order to prepare for a federal monitoring visit this June. Part of passing these 2 rules is that we want to show efforts of progress in some corrective action identified by the Federal Office of Child Care. And we are looking to get a federal monitoring report that's being developed and released July 2022. So this rulemaking today is in efforts to prepare for that to show compliance. The first rule is that we request that the Early Learning Council adopts rules updating the allergy safety plan requirements for licensed childcare providers as required by CCDF. We have received feedback from Federal Office of Child Care that our current rule must be clarified in order to be in compliance with CCDF. Our currently Oregon's OCC has rules on allergy safety planning, but this revision is going to clarify the requirement as well as specify what a strong allergy plan looks like. And most importantly, in clarifying this rule, children who experience risks of allergic reactions will have better protection and health outcomes. Please let me know if you have any reflections or questions.
Okay, thank you, Alicia, for the overview. Council, any questions on this proposed rule?
And Remy has her hand up, and I think it's because she needs to mention something.
Thank you, Alicia. Chair Miller, just really fast for flagging for the rest of the council. I just wanted to note that we had to do some language updates. There were a couple of errors in the original meeting packet, and the language, the correct language has been delivered to your inboxes and posted publicly. So we are working off of that version of the language that should be at the top of your inbox.
Okay, and I understand, Remy, from you that it's nothing substantive.
It's nothing, yeah, it was just a couple, there was like one thing that we accidentally deleted that is nothing to do with this. It was just a small error, and it has nothing to do with the rest of the content, so.
Okay.
Specifically for the allergy rules, there was a prior draft that related only to food allergies. The rule language now accounts for all allergies, including bee stings or those kinds of things. So it's broadening the allergy plan requirement.
Okay. Thank you, Alicia. Peg gives a thumbs up for the broader context. Council, any questions of Alicia? If not, we're going to just go one by one, and I've asked Peter if he would make the motion, and we'll just do these as we go through the agenda. So Peter, would you make a motion for us?
Certainly, Chair. I move to adopt the proposed language dated March 30th, 2022 that adopts Oregon Administrative Rules 414-205-0100, 414-300, 0220, and 414-350-0180.
Thank you. Is there a second for that motion?
I'll second it.
Thank you. Any discussion? If not, those in favor, please raise your hand or thumbs up. Thank you.
I'm going to say aye. This is Katie.
Yes. Thank you, Katie. Katie's in transit, so thanks for still being on the call. Okay, Alicia, next item.
Yes, thank you. We also request that the Early Learning Council adopt rules updating the child development training requirements for childcare providers, again, as required by CCDF. We've received feedback from the federal OCC that we need to create rules surrounding a child development training requirement for childcare providers, as well as developing a training for them to take. We've been working with a contractor to develop the training that's anticipated to be available by August of this year, 2022. This training will be required for all license types, translated in our identified top 5 languages, and must be completed in the first 90 days of hire after September 30th, 2022 for new staff, and by September 31st for current staff. There was a slight change in dates recently made in the rule language. Due to contract delays for the training, we changed this requirement for all current childcare staff to take the training from September 30th and push that back to December 31st to provide more time to allow for the implementation of the training and allow for providers to come into compliance. There is a risk to CCDF and we may face penalization for this change. However, it was a risk we needed to balance to ensure that providers had ample time to complete the training. Please let me know if you have any reflections or questions.
My only question is, what kind of penalties could we be facing? Not that we have any choice, but they're going to take all our money away.
The honest answer is we don't really know, and they may not. They may not be. I think it will likely be found to have a non-compliance. Whether they would actually have a penalty or not, we don't have a clear answer. At this time, and I think there's some discretion around what that would exactly look like.
Okay.
So it as Alicia was saying, it's a matter of, this is a place where we realize there is some risk, but are also trying to avoid the putting our need to get into compliance with undue burden on providers. So I think that's the balance of risk that we were taking here.
Okay, thank you. And I think we appreciate you just pointing out that it is that balance. So good to know as we move forward with these motions. Any other questions of Alicia or David or Alyssa? If not, I'm going to ask Peter to go through these motions. And Peter, I think we have to do one at a time.
Very good. Madam Chair, I move to adopt the proposed language dated March 30th, 2022 that adopts Oregon Administrative Rules 414-205-0040 and 414-205-0055.
Thank you. Is there a second?
This is Angie. I will second.
Thanks, Angie. Okay, discussion. All those in favor, please raise your hand or say aye. Any opposed? Motion carries unanimously. Peter?
Thank you, Madam Chair. I move to adopt the proposed language dated March 30th, 2022 that adopts Oregon Administrative Rules 414-300-0080, 414-300-0090, 414-300-0100, 414-300-0110, and 414-300-0120.
Awesome. Thank you. Angie, will you second again?
Absolutely. I second that motion.
Any discussion? Those in favor, please raise your hand or say aye.
Aye.
Any opposed? Motion carries. And Peter, back to you.
Madam Chair, I move to adopt the proposed language dated March 30th, 2022 that adopts Oregon Administrative Rule 414-350-0115.
Thank you.
And I will second that motion.
Thank you. Any discussion? Those in favor say aye or raise your hand.
Aye.
Any opposed? Motion carries. Thank you very much. Okay, and thank you again, Alicia. I think we're moving to Jay, is that right?
Chair
no.
Miller, yes.
Right.
One more quick rule adoption for you before we move on to our notification portion of the rulemaking agenda item.
Go ahead.
Just really quick, if you'll remember back to our October ELC meeting, we adopted some temporary rules around council and commission reimbursement. The Early Learning Division did not have these administrative rules put in place that allow us to pay commissions or councils that are created underneath the legislature, as opposed to a governor created council like here, or a rulemaking advisory committee. And we faced barriers in reimbursing members of our tribal advisory committee because we didn't have those rules in place. But luckily we adopted the temporary rules, we got the reimbursements going, and now we are just here to codify them permanently. So the language follows ODE precedent, and I'm here for any additional questions.
Okay. And council, once again, this is an updated version that's in our inbox today, because the version that came out on Friday said these were temporary, but in fact, this is a permanent rule. So seeing no questions of Remy, I will ask Peter for one more motion.
I'm trying to find it.
Oh,
Let's see here.
It's
still down here on.
It's page 77. No, 73.
Here, Peter, I'm dropping it in the chat as well.
Thank you. I think I have it. So, yeah, it is. Madam Chair, I move to adopt the proposed language dated March 30th, 2022 that adopts Oregon Administrative Rules 414-055-0000, 414-055-0005, 414-055-0010, and 414-055-0015.
Thank you, Peter. Is there a second for that?
This is Katie, I'll second.
Thanks, Katie. Any discussion? If not, those in favor, please indicate your support.
Aye.
Any opposed? Motion carries. All right, thank you, Council. Those were the action items we had, and now we're going to hear about what is coming up in April and beyond. So now we'll turn it over to Jay. Welcome, Jay. Good to see you again.
Good afternoon, Chair Miller and members of the council. Good to see you too again as well, Chair Miller. The first item on the upcoming rulemaking notifications and updates that's assigned to me is allowing recorded programs and licensing exempt employment-related daycare into the CBR. And so the background on this is these rules are needed to implement parts of HB 4005 and SB 1547, both passed this last session, relating to CBR enrollment for recorded program personnel and licensed exempt ERDC providers. The Early Learning Division sought these changes in statute in order to implement recommendations put forth in the 2020 Secretary of State audit relating to background checks, where they looked at background checks done by OCC, ODHS, and the Oregon State Police as well. In those statutes, they laid the foundation to require those individuals, recorded program personnel, and ERDC providers personnel require them into the CBR. So this rulemaking will add them essentially to the subject individuals. It'll change our rules within the CBR rule set. And so we'll require recorded programs, which of course are unlicensed facilities, for their personnel to be enrolled in the Central Background Registry pursuant to the timelines in the statute. And then licensed exempt ERDC providers will be required to enroll in the Central Background Registry, once again pursuant to the statutory timelines outlined in the relevant statute. So that's essentially it, and we're presenting it now as a temporary rule set. During the temporary rule lifespan, we will be conducting a robust internal engagement with those affected by the rule changes. Thank you.
Okay, thank you, Jay. A quick question. So this is coming back to us in April? Or David or Remy, I think that's what the agenda says.
So we are proposing the temporary rules in April, and then the temporary rules are going to be effective for 120 days, and then we'll have to do permanent administrative rulemaking in 120 days. So I assume that's going to be the September Early Learning Council meeting. Do not quote me on that if I'm wrong.
So we're going to be seeing temporary rules at our next meeting, but that's going to be before we have the robust external, outreach. Is that correct?
Yes.
Okay.
And if it's okay, if I can just jump in here, I mean, the reason that we want that these need to get adopted immediately is in order to have the time for really a transition of providers in this process. Right. So we need to begin this process now. So that's why we're asking the council to adopt these as temporary rules. I think much of the content of these rules is really dictated by the statute. But we also want to maintain our commitment to having an opportunity to hear from stakeholders and make revisions if needed, which is why we're adopting them as temporary and following up, with that engagement process. But the need for beginning the process now will actually avoid clogs in the system, including to providers during this process, during this transition.
Okay, thanks, David, for that added explanation. Any other questions of Jay or David? Okay. Thank you, Jay. We'll look forward to seeing you next month.
Thank you, Chair Miller. Thank you, members.
Remy, KPI.
Yes, I am next. Thank you, Chair Miller. Just a quick reminder on what KPI is, the Early Learning Kindergarten Readiness Partnership and Innovation Program. There is no R in KPI, and that's fine. We're fine with it. We love simple acronyms. The KPI program has been around since, I believe, 2013, and it was modified in House Bill 2054 of the 2021 Oregon legislative session to reflect how the funding has evolved in the funding flow. So the money comes to the Early Learning Division, we dole it out to the Early Learning Hubs, and the Early Learning Hubs give grants within their communities in order to strengthen the linkage between the early learning and the K-12 system. So we did a rulemaking advisory committee, a RAC, around these KPI rules. So we had a really great group of our external partners from across the state who really helped us hone in on what the language, like what it looks like and what it means for our grantees and our early learning hubs. They identified a couple of rural equity issues and helped us wordsmith our rule language in order to best support those. And we are going to be bringing that language to you in the April Early Learning Council meeting next month. There's going to be a public comment period open from April 1st to April 20th, and we are going to be holding a hearing on Tuesday, April 19th at 5:30 p.m. on the language. And I will let you know if we receive any additional public comment on what's going on. And here for any questions on KPI. Otherwise, you'll see me again next month with this rule set for adoption.
Awesome. Okay, any questions of Remy? Thank you, Remy. And I see in our packet, page 78, that the crib bumper ban will also be coming to us in April, is the plan.
We are actually, I think that there's going to be a delay on that at this point. So that has happened since we put out the packet, obviously. And we will come and touch base with you on the crib bumper ban when it's appropriate. Right now, the ban is basically the crib bumper ban that we're talking about. We have crib bumpers banned in all of our rules for infants, and this crib bumper ban that we're talking about right now is, first of all, in statute, second of all, applies to older children, so like toddlers and like a little bit older. So we're still working through like what that language means, but in the meantime, they're banned, it's in statute, and we need to work through finding those external partners who are affected by this, but they're already largely illegal anyway. But yeah.
Okay, thank you, Remy. So on our agenda, it says baby promise rulemaking. David, Alyssa, does one of you want to talk about that? So I don't see it on page 79.
I'm happy to start and David can jump in. So we had convened a really great rulemaking advisory committee, and kudos to Remy and to Dana Blickney-Hubschon and our partners for helping to recruit such a diverse panel. And as we went through that rulemaking advisory committee, some of the equity considerations that came up about professional learning experience, degree attainment, have some implications for preschool promise. And so we wanted to kind of push pause and make sure that we're really looking at kind of the domino effects of any rule changes we might make to baby promise, so that we can think about the effects on preschool promise or any other programming. And so this is work that we were planning to bring to you that we're going to kind of push back a little bit just to do that due diligence and strike that balance between really being responsive to some really clear direction and goals from the rulemaking advisory committee and what that means for how we administer other programs, including any statutory limitations. And David, anything else that you would flag there?
I think the only thing I would add is this is a place where we don't really have currently any external time pressures on the rule adoption. So we do have some flexibility in taking our time to sort of think through. It was obviously a most important and a complicated issue.
Okay, great. No, that's great that you have time and are really including the RAC feedback. So that's what RACs are for. So sounds good. And then council, as you know, on page 7, the last page of our packet, 79, upcoming at future meetings will be the early childhood suspension expulsion that we heard about today, Tribal Early Learning Hub. Is Valeria here? She was on the agenda. Does anyone?
So Valeria actually, yeah, she unfortunately has to step away from this meeting for unprecedented circumstances and asked me to fill in for her really quickly since we've been working together on the rulemaking process.
Okay.
So I'll just jump in and give a quick update. And just kind of explain how we are moving about the rulemaking process with the Tribal Advisory Committee and the Tribal Early Learning Hub, because it is a different process than we take for the rest of our rulemaking. So in a general rulemaking process, we put out a request for applications, we find external partners, we convene a little group, we talk about it. But with this one in particular, we wanted to uphold a true government to government relationship. So we worked with the Tribal Advisory Committee to determine how we were going to form that RAC, and didn't want to do any sort of appointments from the division side of things. We wanted the tribal nations to appoint members to the Rulemaking Advisory Committee. So we have members of our Tribal Advisory Committee who are going to be, the Rulemaking Advisory Committee is going to be functioning as a subcommittee of the Tribal Advisory Committee. So several members, one member of each tribal nation is going to join us in the Rulemaking Advisory Committee. Those are going to begin, I believe April 20th is going to be our first rulemaking meeting. And we're going to be looping in the whole Tribal Advisory Committee regularly with the work. Right now we have a draft rule set that we've been working on with our lawyers and some of our internal rulemaking experts. So we feel really good about our first draft going into this Rulemaking Advisory Committee, and we're looking forward to working with our tribal partners to get the final draft going. Right now, we are planning for the rules to be presented at the June Early Learning Council meeting, but that's all very contingent. Another thing that's going to be different about this process is that at the end, when the Tribal Advisory Committee accepts our final draft of rules, they're going to individually take them to their governments for vote within their individual governments and bring the vote back to the Tribal Advisory Committee. So if that process takes longer than June, it is not a problem at all. As with other rule sets, there's no time constraint on this, and we're looking more to do it right than do it quickly. So we are planning on the June rulemaking presentation. However, it might be September, since we're not going to have any summer Early Learning Council meetings. And our Early Learning Council member, Angie, very valuable member of several committees now. I'm not sure if I'm missing anything, Angie. If you want to chime in, feel free. But that's about all I have to say on the process, unless there are any questions.
I don't think I have anything to add, Remy. Thank you. I think you covered it very well. I do appreciate that this does make things take a little bit longer, but I know that each tribe feels like they're being valued as a member of this TAC, and everybody has a representative for the rulemaking committee. So I appreciate the process, even though it's slowed things down a little bit for you all. Thank you.
Thank you, Angie, for serving in this capacity too, to represent the council on some of these councils and committees. And Remy, thanks for the update. Sounds good. We'll look forward to June or September or whenever we see those rules. Okay, so council, we are just about out of time, obviously. Carrie, I see you're still on the call. I don't know if you want to say anything in the next 2 minutes that sort of summarizes what was supposed to be a 15-minute presentation and conversation knowing we're going to see you again in April, but.
Right. So I think the big news is just that the work has been moving forward, and the group that was going to analyze the quotes from the 3 community listening sessions that were conducted in the fall did happen in January and February, and they went through a 3-part process to identify the quotes, identify root causes that those quotes were identifying, and then identified whether that was local, regional, or state had a role in addressing the issues that the family members raised. We have a chart and we have some initial ideas of some recommendations for the state to consider, but we realized that it wasn't quite enough detail to let you know where there's opportunistic areas to take advantage of moving some things forward, and that when we go back to the Josephine Jackson communities and the Portland Black family community that we met with, where we wanted to talk about opportunities and have them give continued feedback and shape it, that we needed more details. So RUAC members are working with me now to look at those ideas of where the state could be responsive to the families in those communities, to get more specific of what's possible now, what could be possible in the midterm, and what could be possible in the long term, for you to come back and give guidance on next steps, as well as what you thought about the community listening process in general, and how the council might want to continue to engage, change, or keep the process that you started this fall.
Okay, thanks, Carrie. Peter, anything you want to add to that as a member of the council committee?
Just thanks to Carrie. Way to wrap that up in less than 2 minutes flat.
Thank you. And Peter, Peter and Kali, thank you for serving on that committee and helping with that. And as we hear about community engagement and family voice from every partner we meet with, it's certainly something we want to figure out, where do we fit into this huge statewide effort. So that'll be an interesting conversation. Wow, what a meeting. Council, we are moving forward. I'm very excited about our new home visiting committee, yet to be really figured out what that is, but we'll figure it out. And I thought the ODHS presentation was certainly excellent, and asking for our input and our partnership as they try to realize this vision for transformation, which will certainly have an impact on the kids and families we try to serve. So Alyssa, thank you for being here as much as you could be. Thanks for your leadership and getting a whole new state agency set up in your spare time. We appreciate the fact you don't need to sleep at all. And council members, thanks for your attendance and your involvement. This is exciting times for all of us. So with that, we are adjourned, and have a great afternoon, everyone.
Thanks, everyone.